Okay, it says it's live. Does it?
Hi, welcome. Good evening to everyone around the world. Good morning to US, and welcome to Kim and Nick from USA. And we are live discussing about COVID-19. So, Kim, what's the situation in your country?
Well, Ankit, as we were discussing yesterday, things were looking pretty bad. I was on the phone with Miami people for about 2 hours last night, maybe 2.5 hours. The concern is very high because right now, a lot of people are fleeing New York and heading to Florida. There are not enough beds in the hospitals in Florida to take this influx. I think the reason why people are fleeing, and this is a conversation we had, is people are still misinformed about coronavirus. There's still the misnomer that it does not evolve in warmer climates. That is a huge misnomer. I don't think the president changed his note on that until March 11th. I try to keep track of time, date, event of when things happen. And the last time I heard the president say that warmer climates would be safe for us would be March 11th. But New York is, we get different reports.
Yeah.
When I talk to Ashok, I feel very confident and safe. But when I talk to other people up there, it's a mass hysteria. We watched Fox News last night host a music show to raise money for the first responders to help feed children that are hungry at home. And there were nurses that would come on and they were crying because they said that this is far worse than anything I've ever seen. They're working hard 13, they normally work 13 to 16-hour days, but this is the hardest 13-hour days they've ever had to work in their life, and the most depressing because so many people are so very deathly sick. And it just, I don't think people are taking this serious enough, and they don't either. So their message last night was the medical profession was on talking to everyone. They just talked to different, and please stay home. It is the most horrifying scene they've ever had. And so it was very endearing, and I'm glad that they did this, but I still don't think people are taking this serious. And I'm going to, talk to Nick. He might have a better input.
Yeah, I have an input. I'm not sure if it's going to be better or not. I have an opinion. I'm not sure if it's going to be better or not. But see, one of the problems is Ankit here is that there's we're increasing at about 20,000 new cases per day. Now, with that, next week we'll have over 250,000 people that are infected. Now, that's pretty easy to predict. That's what's going to happen here. Reason people are leaving New York is New York is very congested. I mean, you have to imagine it's a lot like New Delhi. The people are all on top of each other, and it's hard not to be. So if they get in planes to go down to Florida, it's a little bit more spread out. They have a little bit more room. And of course, they believe in the warmer climate theory. Well, all that, what does it create? People touching each other, subject to infections, frankly, increasing the infection rate. But it's really hard not to go out. In other words, to isolate yourself in a room and say, hey, I'm not going to go out and do anything because you need to eat, you need to get this stuff. I mean, whatever. And then all of a sudden you're subject to being infected. So we are growing at a very rapid rate now. I mean, I think we're over 146,000 people right now as we sit. And every day we add 20,000 more. So it's not hard to predict we're going to hit the 250,000 mark sometime next week. Now, the death rate is actually pretty low. We're still staying in the 3% or less rate. So on that, it's pretty good. But part of the reason why is the treatments here are pretty good using the ventilators, and the doctors are doing a good job sedating people, basically making them unconscious, then putting them on ventilators. So the healthcare system here has been doing a good job, but it's under a lot of stress. We believe that somewhere in this month, it's going to basically max out the healthcare system. In other words, please don't send us another patient. We don't need one. The thing that's also very promising, if there's anything, is the Madera Group, and I'm trying to get them on our show out of Boston. Boston has a lot of good biotech groups. Is already has a vaccine that's already going through clinical trials right now, and then there's other technology they're using is actually plasma from people that have already gone through the virus and re-injecting them again. Now that's another technique that may alleviate the virus. So there are some what I call solutions out there. Mr. Bill Gates, and this is part of the reason I got thrown off on Facebook. I posted Bill Gates's videos that took place 5 years ago and 4 years ago, respectfully. Hey, Willie, and these videos, what Bill Gates did is he explained the biggest problem we're going to have in his lifetime that he believed was a virus. In other words, he says nuclear war, he goes to low probability, volcanoes, low probability. He said virus, high probability. Now, he works a lot in biotechnology. So I think people tune him out because of the bias, and also because, frankly, we don't want to listen to Bill Gates anymore. We heard him 30 years ago when he said computers are going to be big. I mean, who wants to listen to this guy? And software is even going to be bigger. No one wants to listen to this guy anymore, right? So 5 years ago, he was saying the biggest threat to the United States, and he estimated the cost in the world to be $3 trillion. I mean, you see his video, it's like the guy's a prophet. He just said, okay, well, this is going to happen. And we tuned him out completely because, like I said, we don't listen to Bill Gates anymore. So I posted his videos, okay? And, of course, that becomes spam in Facebook's brain, and they block me.
They kick him off.
They block me. Okay, like, okay. So what he probably did is he kept going to TED Talks, kept preaching this theory that viruses would create this huge problem in the world, and he just got basically blown away. I mean, people ignored him. Goodbye, Bill. Thanks for sharing. But he actually had some great ideas in terms of creating task force like we do in the military, moving in once you have a virus, containing it, and keeping it down. Well, we didn't do any of that. So what we did is it's just like, boom, here it is. Now what are we going to do? And that's the response that we had, a what are we going to do response. The correct response is to isolate people, and also got to come up with a vaccine. And I posted that several months ago. Got to do the vaccine. With that, here's what's going to happen. Hard not to predict. And I haven't did my stock market check yet, but I can tell you it's going to have an adverse effect on the market the next 30 to 60 days down. And I don't care. They put $2 trillion on the boards.
I think it's going to work.
The $2 trillion is great and wonderful, but it's like, in our country, $2 trillion out of a $20 trillion economy is only 10%. The job losses are going to be horrendous here in the next.
That part's going to be bad.
Yeah, the economy is going to suffer unbelievable in the next 2 months. So we're going to see that. Now, the promise is really, like I said, the Madera Group, Gilead Science. I'm going to try to bring them on board. Really hard to get these people because they're busy doing what? Trying to make doing tests on, what do they call it, vaccines. But I've been following both of them, and the high-tech sector in Boston is actually very, very good. They do have some really good people working on this. And we do, and Bill Gates even said that he said the reason why this is going to be worse than the Spanish, he had it all outlined. It's going to be worse than the Spanish flu is because our transportation systems are better. Like I said, I was going to go visit you in Ankit. It's only $800 round trip. I mean, why not? Fly to New Delhi. Okay. I visited our friends in Rome a couple months ago, now many months ago, but why not? It was, less than $1,000 you can go round trip to all these cities, and so people travel. I haven't been down to where Willie is, but I haven't been to Melbourne, but I was to Sydney and Brisbane and Uluru and Cairns, So I got my Australian fix. You know, we can travel around the world a lot cheaper than we ever have. And so what happens when there's a little virus in Wuhan, China, wherever the heck that is, it just goes boom. And Bill Gates said all this in his thing. It just goes boom across the world, you know, just like that. And we just don't have the. But he also said this: we do have better technology and communication that should be able to mitigate that. And the technology is actually the we were able to actually get, I think it was from Australia, they actually had the DNA of all the coronavirus, and that helps the scientists develop the antivirus for the vaccines for the virus. So I think that's going to come out faster than people think, as they're already going through clinical trials starting today. So,
well, I think you're right on that, Nick, because there were clinical trials going on with the other coronaviruses from SARS and MERS. There had been patents on some of these several years ago. And the experiments they've been doing, get this, have been on chickens. So they've been doing meat. Right? Meat.
Yeah,
so
yeah.
They were doing it on poultry.
Yeah, but see, the problem with doing animal trials is the thing is they're not the same as humans. Okay, the DNA composition's the same, not the same. It's just like the dog. They say the dog doesn't even get this stuff. But
let's look at the issue. Chicken. Apparently, the respiratories of chickens. They were trying to figure out a way to protect the livestock. So they say.
Yeah.
And but if they were practicing on chickens with a manipulated coronavirus in, say, China.
Yeah.
And somebody accidentally disposed of the chicken wrong, or thought, hey, you know, people are starving in China. Why not make a few extra bucks for me? And so instead of disposing these chickens, I sell them. What if that was where it came from? Because we know that they practice this, they're practicing on chickens. We know they're testing on chickens.
Well, yeah. Well, I believe actually the vaccine has already been developed. Okay. The only problem is we don't have proof of concept yet. In other words, I believe as we sit here.
Yeah, I believe the vaccine exists. I agree with you.
Yes,
who are going to test it on?
Okay, but it hasn't been tested, hasn't been proven, hasn't been proven the dosage amount, and hasn't been manufactured and distributed.
And
so,
how do we know it's safe for humans?
That's the whole point. That's the whole point. All the testing hasn't been done, but I believe it's out there. Okay. Now the question is, how quickly can you get it approved and get it to the market space? Now, if you fast track it, it could actually be in the fall, believe it or not. In other words, I believe actually it could be in the fall. They could actually fast track and say that this thing works or not. Part of the reason why is that the coronavirus apparently develops very rapidly in somebody, unlike a lot of viruses. So you get sick, a week or two later, you get real sick, better. Here, what happens apparently, according to studies we've seen, that you get sick and then like in 12 hours, you're on a ventilator. I mean, it's like, are you kidding?
Well, it's not just that. Actually, they say the incubation period in the body's quite some time. The problem is you're contagious the minute you contract it. Yeah. But you don't have a symptom, so you don't know you're sick. Okay, listen to this. We have workers still going to work in Raleigh, right? So we had a contractor that walked in with a fever yesterday.
Yep.
Into a building where 500 people are still working. Yep. Okay, we should be limiting our impact by 10. They got 500 people in that building working.
Yeah, sure.
Right? One contractor walked in with a fever and he contaminated everyone, and So they're isolating the most. But what they forgot, we got idiots in this state, pure idiots. What they forgot was he was contagious
14 days
ago.
Right.
And so how many people did he come in contact with? Are they even looking at that? No. Okay, so that's what I have a problem with. That's why we're spreading so fast, because we're not thinking. We're taking
the other thing is they don't have the testing. They don't have the testing kits, and that's one reason. There's some countries say, like South Korea, testing was the key. We want to test, because then the thing is, then they can isolate and move in more rapidly than you can if you don't test. And so the thing is, and this is where Bill Gates was really, like, he was spot on. I mean, we just lacked the basics here, and he said it wasn't going to be hard, but it was going to cost 400, 500 million, maybe several billion a year to maintain a system that did this, but we ignored it completely. I mean, it was like, completely ignored. So right now, even if somebody was infected, yeah, here's the problem. They could have been seeing people for 14 days prior, infecting a lot of people unknowingly. And then they're not tested, and we don't test the people that they infect, and they go and they infect other people. So it grows exponentially, which we're seeing right now in the United States. We just added 20,000 more. We are the world leaders. Okay. So the people in Australia and India can realize we're leading something again. What are we leading? The most coronaviruses, okay, in the world. Okay? But that's part of it is because of our systems and our demographics. Now, half of it does come from the New York City tri-city state area because it's densely populated. If anybody has gone to New York, you live on top of each other. And so it's much easier to spread. As you go into the rural areas, it becomes negligible. There's still some, but very, very few cases. But there is the potential of it exploding, even in rural areas, is extremely high. So I think right now that is we're doing the best policy. It's going to have an adverse economic effect, even though the market's up 42 points. Let's watch it for the week. The stimulus was right to do. There's no question about that. Because remember, even the stimulus, it's going to take a while because everything lags for the funds to get distributed and roll through the system. And they found that out during the 2008 crisis. So we do something, but there's this lag time. So we're always facing this lag time going into the future, no matter what we do. And we need to move more rapidly, which we can do, and we need to enhance our technology, which we can do. And like I said, I believe there's already a vaccine that works. We just don't know which one and how. Okay.
So let's also talk about they claim that if the more you can test and isolate people, there are rapid test kits coming out now. One of them that IPO'd 2 days ago or on Friday. It's coming out. It's a 5-minute test kit. We saw a 15-minute test kit a couple of weeks ago with Juan. And when he came on the show to share with us that don't buy from the black market, don't self-test, get it from your doctors. But of course, you're going to have people who go, well, I'm not able to get it from my doctor. We also see a price gouging and things like that. But talking about this in a financial means in the stock market, when we see products like this being promoted, is that something maybe we should invest in to kind of recover and recoup our losses?
Well, I mean, the thing is, right now you're probably safe is to be in cash. I mean, that's it. And the market is already reflect. I mean, there's positive stuff in the marketplace.
Right.
Things like Zoom.
Nick,
Go on.
I have a question, and most of our viewers also would like to know that people are talking about markets and people are talking about profit and how the financial sector would affect the corona crisis. But when we do a lot of bailouts to banks and to insurance companies, do you think it's the right time then they will put the money back into the system and then we can use those money in the public sector? I think Willie also raised the same question.
Yeah. See, the thing is, there's always been a top-down theory. In other words, if you give it to the top 1%, it's going to, quote, trickle down to the bottom, which we know is not true. But there's still people in the United States who really believe in that. I mean, it's just the way it is here. But with 330 million people, you always got some fringe groups out there. Now, the latest bill actually does have a bottom-up, first time I've seen it, a bottom-up theory, which they're actually giving money to everybody, which is really unusual. And Kit, in other words, they're giving it to workers, gig workers, etc. In other words, they're giving it to the real people actually do the work, as opposed to the banks who all they want to do is lend it to you, quote, lend it to you, so that you're still owe them money. So this is the first time I've seen a bottom-up theory and take place on part of the $2 trillion, which I think will be very beneficial because those are the people that actually do the work. But in the meantime, for the next 30 to 60 days, I believe they're going to be out of work. In other words, they're not going to work, and that's going to affect us adverse. It's going to have an adverse effect. Now, I know also in India, your president, because they have Indian every now and then we listen to Indian on mainstream TV that Modi goes, well, we're going to have a lockdown in India. Well, some of the Indians go, wait a minute, I don't want to be locked down and starve to death. I mean, it's like, okay, here's your solution. We're going to lock you down and then you starve to death, which is also a problem here. Hey, we're going to lock everybody down, but what is going to be the cure, the starvation effect? So there's got to be a balancing act somehow to take place. My thinking is the vaccine. In other words, if you're going to move toward a solution, you can make people less asymptomatic by using these injections of people. In other words, once you got sick, we're going to inject you with fluids from people that were recovered. Okay, well that's more of a reaction to somebody who already has that, in order to try to prevent them from dying, basically. Ventilators, well, that's a reaction for somebody who already has it. Vaccines. The vaccines are the solution because the vaccine actually builds up antibodies prior to you receiving it. In other words, it basically stops you from getting the virus. And so that's where we need to head to, like it or not. Get some of these vaccines out there. They're doing the test right now. Do them as fast as you can. I'm not sure how fast you can actually get them through a clinical trial and get them to the marketplace. Now, here's the problem. Just as you know, with any vaccine, there's going to be adverse effects. A certain amount of people may actually die. In other words, they take the vaccine and they die. And the drug companies, what they don't want to be is held liable. Okay, I gave the vaccine to 1 million people, for example, and of that, 30 died, and they all sued me.
They sued.
Yeah,
I mean, look at that one lawyer supposedly suing China.
Yeah, I saw that lawyer. The lawyer down in Boca who's suing the Chinese government for $20 trillion. Good luck.
Did he really file that suit? Because I didn't see a case number. Usually I looked at
I don't know. I'd be embarrassed to be that particular person because it's so legally non-compliant. It's not funny. It shows to be a member of the Florida bar. I don't know how long that's going to last. But anyway, the thing is. Okay, so see, the thing is, the real problem with the drug companies, there is a liability. Okay, let's imagine they can send out 1 million vaccines, okay, and in their clinical trials, 30 people died, okay? They go, well, I got to get that number down to 0, and it may be next to impossible to do that. Well, then I'm held liable for those 30 people because they sue me for millions of dollars because I died because I took the vaccine, and that's the problem with the vaccine industry. Basically, is the liability. It's basically, is the cure worth it? And now the 30 people, of course, are going to be age 85 with prior conditions, because remember, the vaccine you're basically injecting the virus into the person's body to produce antibodies. You see what I mean? Well, you do that, and the person 85, well, it didn't work for me. Yeah, died. Okay, and then the lawyers slap lawsuits. And this is one of the real problems. Can they make it completely safe? Yeah.
But can we have self-volunteers who would like to test the vaccines on their body? I mean, there are a lot of people who self-volunteer themselves as well. And also, people are talking about vaccine, but I still believe that we have to test it, and people who are positive, then only we have to use the vaccine. And we are still not sure of the test problems, because people are claiming that test can be done in 5 minutes, and then we have the reports. Then they'll say that 15 minutes, and then someone is saying 20 minutes. In India, there's a company called MyLab, which have created a test kit basically, and one test kit can, at one point of time, can test 100 people. So one vaccine can do 100 tests at a time.
Mm-hmm. Yeah.
When you talk about the results, they also not sure that what time the result will take, because it's not coming in a couple of days. So the problem is we have to have the results ready, and then we can do the vaccination.
Right.
Because if we have vaccination, I mean, I don't know how we will use those vaccination if we don't have the results ready.
Yeah. I mean, that's what they're trying to do. Probably, and that's part of the reason of the isolation, is to buy time. Really, and they call it flattening the curve, to lower the amount of cases that are out there, but actually to buy time for the pharmaceutical industry to actually come up with the vaccines, because we need the time. Now, one commentator said, well, we'll have it all ready in the next 8 to 9 months. Now, that commentator is probably being realistic, if 8 to 9 months. The real problem is that we don't want to hear 8 to 9 months. going through the new what is known as the new normal. But let's say that's the realistic new normal. This may go on for 8 to 9 months. Definitely going to go on for the next 2 months. I mean, there's just no question. If somebody
I think our graph is going to go up for 2 months because our count has been based on tests that were done 10 days ago. So our count is back 10 days. So I think our graph is still going to climb for 2 months. We're not going to see a flat line for 3 in America. I think Australia, India, they're going to see a flat line in the next 3 weeks because they took extreme precautions about a month before we did. But look, this is the new mask that they're wearing along with a face mask. So they wear this shield with a face mask and eye goggles. They wear this shield now. This is what the doctors and nurses are wearing. So it is aerosol. They do believe that to me, that's airborne. I don't know why they pick another word for airborne. But it is aerosol. They showed a video of people that have it are in ventilator tents, but they're behind tents, and the nurses stick their hand in the tent to measure their temperature, take their blood pressure. So they don't even enter the tent. In some cases, when a person's sick and they're ICU, intensive care, they walk in very well clothed, but they're still able to touch the patient. They're not in it. Very rare have I ever seen somebody in a tent. But all the patients are in a tent, and the doctors touch them by sticking their hand through the tent. They're not really going to, but they're wearing this along with a really tight suit now, which I thought was interesting.
Mm-hmm. Yeah.
And I think because
what I'm showing is that sales on items like this are going to go up financially. I think that's where our market's going to start taking a climb. Is medical supplies like this are going to rapidly grow.
Certainly.
What do you think, Nick?
I was checking about the COVID gears or safety gears or hygiene gears around the world. So now we have ear caps. We have ear caps.
Okay.
To cover your ears.
Well, because it gets in the ears. It gets on the ear too.
But I've never heard about this ear caps earlier. Yeah. So now they have hair caps as well. Not hair the cap, but hair netting kind of a thing, which can keep you calm, and it's easy to. I mean, wearing better than a cap basically. And then you have a complete mask which you cover it, and you have some ventilation going around so that you don't feel. You don't feel sick inside. So there's a lot of things going around, and they have a lot of gloves. There are a lot of different things going around. And also, there was a video from China that if you can't touch your phone, mobile phone with your hands, they are working on some kind of a gadget which allows you to handle your phone without touching with hands.
So for a long time there, they had like a hologram, right? And there were some people inventing, but they kept running out of money. But they invented a hologram that would beam on your wrist, and you could do it. It was all hologram. So there was a beam that came from your phone somehow. What was a wristband you wore that sent out the beam, and you did everything on your arm rather than a phone. But I don't think that you're still touching things. You're still being contaminated. I just think isolation is still, but the phones can be our dirtiest thing. But if we're being isolated and we cleaned our phones, but people were coming up with that concept because they felt like 5G was going to be very, very dangerous. And I'm going to have in the near future, as our COVID-19 talks kind of die down a little bit, I have some experts in the 5G industry that are going to share a little bit about 5G with us and how it benefits us. We're going to weigh the risk and benefits. But Nick, I see our stock market going to climb with.
Yeah, it did. It climbed due to the fact that the $2 trillion stimulus package was passed last week. So I expect it to climb based on that emotional response.
So we're only getting $1,200 each per. I mean, I hate to say only because that's a lot of money. Actually, to me, that's a lot of money.
I know, but I'm just saying the thing is it's climbing because of that. It's a reaction to the stock market thing. But here's what's going to happen: the unemployment numbers are going to come out. They're going to be horrible, and so it's going to go back down again. The containment. Well, we're not containing it. We're increasing at looks like at a steady pace of 20,000, and that's going to drop it again. So this whole month, because everybody's basically off this month, is going to be just an economic disaster. There's just no way around it, and the market's going to reflect it. So my thinking is that because when we do our think tank every Tuesday in Salt Lake, our bottom line was 18,000. Now I'm thinking 15,000 to 12,000 on the S&P 500. I'm very bearish right now because there's no way you can be a bull here. And like I said, that all those solutions, well, I got a mask, I got a ventilator, those are just putting Band-Aids on a gaping wound. Okay.
Exactly.
You got to stop the bullets, baby. In order to do that, you need the vaccine. So the vaccine should be our number one priority. Is get the vaccine, get one that works, and get it out there. Because without that, this thing isn't going to stop. And it could be 8 to 9 months. That might be a more realistic time frame than this. Oh, we're going to get this thing done in the next couple months. Even if we got the vaccine out in the fall, it's not going to be distributed there. So I think we're looking at a good 8 to 9 months of this being the new normal. And now the question is, how can we adapt to this this new normal? This is what I'm saying. So there isn't a lot.
Go ahead and put that up, Ankit.
What do you got, Ankit?
Yeah, I'll just share the stat from John Hopkins.
Yeah, John Hopkins actually has some good stuff.
Yeah.
Oh, I love John Hopkins University. They're one of the first.
A couple of things on the theory of warmer climates. The theory of warmer climates is the humidity actually takes the virus down because of the humidity. In other words, the virus goes out, but then sinks a lot faster. Hence, the warmer climates, as you notice, tend to have less because it's harder to spread the coronavirus in warmer climates. The other thing is they say if you drink a lot of fluids, it's good because if you have the coronavirus in your mouth and you drink some fluids,
it washes out.
It goes down to your stomach and your acids eat the coronavirus alive. So the thing is, those are again other commentators. I'm not a medical specialist.
No, but hence the theory of drink a lot of fluids and wash out the acid.
Right. Now the SSRN study, when you have the map there, you'll notice that in Africa, parts of Africa, and the warmer climates tend to have less. Now, the study that was done by the group out of MIT that's published on SSRN said 90% of the coronavirus exists in warmer climates. But again, they're just looking at the demographics as they get them. Again, the problem is we don't know how accurate it is because we don't know the testing that's been done in Africa. But you do notice that it looks like, hey, there's very few cases. The other problem with a map like this is it shows the places that have it, but doesn't show the extent that they have it. In other words, when you're looking at data, you got to be real careful because you're looking at, oh, wow, look at this. The whole United States is infected, which is not completely true. There's some counties that actually have none. As you go into the rural counties, some of them are less. Like in our county, we have 2. That's it in the whole county. So demographics like this are off because they don't tell you the exact numbers. If you go to New York, they have 50% of all the cases in the New York City area, half of them. So of the 147,000, 70,000 will be in the New York City area. Now this is getting a little better. All the major cities are the ones that light up like fire here. Now, Willie, you've been quiet down there in Australia. you were the first one to do on our show the toilet paper prediction. Okay, and the toilet paper prediction turned out to be correct. They buy a lot of toilet paper here. What is going down under right now in Australia? I don't know. Can you move the map over to Australia? Let's see if we can. Let's see if we can go down under because he exists on the other hemisphere, and Australia is like. I know, and kid, it's hard to find Australia. If you ask half the Americans find Australia, they'd be pointing all over the place. Okay, it is there. It is a country. Okay, as a matter of fact, some people think it's a whole continent. There it is. There it is, mate, right down there. Now, see, this is very interesting because you notice that in the midsection, there's no coronavirus. You know why? Willie, no one lives there. I flew over that. The only thing there is roos, baby, otherwise known as kangaroos. That's it. Kangaroos in desert. So you can't get coronavirus in Canberra, in Uluru because no one's there. It's completely vacant. So there's a lot of safe places to be in Australia right now. But now you go to Melbourne, Sydney, Brisbane. Now, interesting.
I think it's on the other side of Australia, not the other side.
Yeah, but why isn't Karen's getting it? Because they're in a warmer climate, maybe.
Mm-hmm.
Noticed it's
yes, that's true. My daughter's in Northern Territory at the moment, and the stats in Northern Territory is like 14.
Really? Yeah, right. See, the Northern Territories, and this goes back to that warmer climate theory,
yes,
which, by the way, may be true as we head into the warmer areas. All of a sudden, we're flattening the curve. Look at all the good stuff that we did. Well, guess what? In June, July, and August, it gets hot here in the United States, and all of a sudden, the coronavirus starts going down. It'll start possibly what they call increasing at a decreasing rate, and that probably will happen in June. I would not doubt that. And
the other thing to verify that is the number of tests being done. All of this means nothing if the tests is not out there getting done.
That's the problem with the demographics in Africa. Yes. Hey, look, there's nothing in Uganda. Why not? Well, no one got tested. Great. So you don't know.
We also heard from Dr. Yu that the sun helps absorbing the vitamin D into the body. He really told people, go out, sit in the sun, absorb the body. Now, I would caution on opening your mouth really wide and letting it absorb in your mouth because a fly might jump in or a bee. But I've been sitting outside absorbing the sun. It makes you happy, right? It gets rid of that whole humdrum feeling. And it's healthy anyway. But he said a little bit, but like somebody told me, well, Kim, sun cancer, cancer from the sun can kill you. And true, I think there's a balance. There's just a balance to a healthy lifestyle. If the warm weather kills the germ or the sun kills it, it's just nothing but a vampire that sucks us anyway. But, Nick, you reminded me of something when you said just drink water and it goes to the stomach and the acids kill it. I want to share something with you guys real quick, if you don't mind. Hold on. I'm going to share this with you because this reminded me of. Can you hear it?
No, we can't hear. Can you expand it?
Hold on. I'll unshare. Hold on. Let me start over because it reminds me of when you pour water on something and it melts. So hold on. We got to have humor, right? We got to have a little humor. Otherwise, we're not going to survive this. But, when you drink a lot of water, they say liquid is a way to deflate the cell. And I think of this.
You cursed brat! Look what you've done!
So drink a lot of water and melt the corona.
But I think hot water is more suitable than the regular water because if you talk about water, we can have a man-made rains going around the world, but
right.
But because hot water, or maybe if we gargle with salt or turmeric or any antibiotic, that would clear your throat. And we have campaigns running in India that they prefer people, or they are vouching people that drink a lot of hot teas, maybe tea without milk, maybe ginger tea or a turmeric tea, and do gargle regularly, and you will be your throat will be good enough to have more respiration. That's what the message from India.
And wash it down to the stomach, and the acids will eat it away. Nick, I love it. I am just so on that. Let the acids.
But that doesn't mean, again, a cure has been found. In other words, again, what you're doing is you're throwing Band-Aids on wounds all the time. Okay, without the vaccine, that's all we're doing is we're swatting flies in a horse barn. Okay.
Well, Dr. Yu mentioned something that, certain liquids deflate. They know the nucleus of this particular coronavirus is very weak. It's very spiky on the outside. It will get in you. It will hook. It will continue to grow and hook and tear. But if you deflate it with things like a peroxide solution, rinse out your nose, your ears. He said ears are very important. Rinse out your mouth with peroxide solution. It deflates it. Like you said, he said don't drink it. But if we are doing these things, they help. Right?
They help. They help. But the thing is, it's like I said, it's like swatting flies in a horse barn. I don't know if you've ever been to a horse barn, okay? But go to a horse barn.
Yes, I have.
Okay, swat flies. What happened? Does that mean that all the flies are dead, or do more flies tend to come back?
Oh, let me tell you something. With all that horse poop, they grow faster than.
That's exactly right. So what happens is all these quote, "Hey, I'm going to get a mask. I'm going to get a ventilator. I'm going to do this. I'm going to do that." Okay, you're just swatting flies in a horse barn. Okay, the only way you're going to stop this is a vaccine.
The vaccine.
Okay, that is the realities of the situation. No matter how much you gargle, I mean, all that stuff is good. Don't get me wrong. What you're doing is trying to prevent yourself from getting it. You're trying to alleviate symptoms if you do have it. But if you want to put a big stop on it, big S, you've got to get the vaccine, because without the vaccine, this stuff is not going to go away.
So let me ask you this. We know that the vaccine's probably in the labs right now, but are they going to allow monopoly on the vaccine? Do you think that they're only going to allow one, or are they going to allow many? It would be my thought. You get the ingredients down and hand it to every lab in the country to make it. That would be my.
Yeah, that's a good question, because see, even if it is developed, the next thing is there's always the manufacturing and distribution problem. Now we know once it's developed in India, they'll manufacture it like that. They'll have millions out tomorrow because they can mobilize their billions.
Because they care about their people.
Nah, they got
not profit. They care about their people.
No, they got a billion.
They don't care about this.
Look. Yeah, right. They got 1 billion people they can mobilize. They got the whole Indian
They care about them.
They have the whole Indian army. They have the Indian army, and the Indian army comes out with 1 billion people. They can manufacture the stuff, and everything will be gone.
This is America.
Right. Well, that's
we pray in God we trust on every one of these, and that's not true.
Yeah. Well, the thing is, they'll manufacture it. It'll be out in no time, as soon as it's developed and they get the blessing. Oh yes, this thing.
I'm going to come visit Ankit when I can, and I'm going to get the vaccine in India because they care about people. And then I'm going to go visit Sasha and have a big party with Sasha because he's got the best bar. Yeah. And visit Willie in Australia because they're going to have all of this.
Wait, Kim, why are we letting India develop the vaccine? Why don't we let China do it? Wait, they caused the problem, didn't they? Sorry, my bad.
No, I agree with you. China already has it. I truly believe, because you cannot have a vaccine without having the antibodies from an infected person that survived. That's where a lot of the vaccines derive from. Of course, that's not where the final comes from, but they've had more opportunity to test this than we have. Now, I believe the test kits we're using today are from the previous coronavirus trials, and that's how they're able to do this. But I think that Nick, I'm sorry if I accidentally sent you an email. My thing was on voice, but so ignore it. But I think that that we've got to get back to the basics and stop allowing people to monopolize this. I think when a solution comes out, if we agree on one solution, then all the university labs should be allowed to make it. Other manufacturers should be allowed to make it. And, we don't need to focus on the monopolization of this. because everybody keeps asking, where's my money in this? Like if I offer somebody a TV show sometimes, hey, do you want, even now, because you're sitting at home, do you want to do some pod TV? Where's my money? And so everybody's about this. They're not really about what we can do to help each other get through this. It's like you said, we're all going to be broke anyway.
But I think not everyone, but most of the people are talking about money. Not everyone in the world.
Not in India, not in Australia. You guys are talking about let's survive. Italy. Do you think they're talking about money in Italy? No.
No, I'm trying to get.
And also, I'll tell you, we have so much of donation and things going around in India. I mean, we have never seen such a situation before, and people are donating millions and $1 billion as of now in India. And you won't believe that around 10 million people who are volunteering and donating and supplying food across India.
Mm-hmm. Yeah. See,
So
I mean, this is what we had to do. Our government isn't doing this. Our celebrities got on a show last night, and they were raising money to feed people who are hungry right now and staying home. Our celebrities, not our government. Our celebrity, not one government official was on that show.
And I'll tell you what happened in India. All the politicians, all the people in the central government, state government, they have donated their 1 month salary. All the celebrities in India, most of them, they are donating money on daily basis.
You hear that? That's their stimulus. Their stimulus didn't come out of. See, our stimulus still comes out of our pocket. I don't care what anybody says.
Yeah.
But this is what I've been saying. If our government's telling us to stay home and not make money, then they need to stop their paycheck, and we spread that across everything. Because
you brought up an interesting capitalistic issue, okay, which is, let's imagine Gilead Sciences, like I said, I'm trying to get Gilead. I've already invited Madeira on, but let's imagine they did develop a vaccine that actually does work. Okay. Now we have a pricing issue because they're a publicly traded company and they have stockholders to answer to. What do they charge for the vaccine? In other words, if they have a patent on it, think about it. Okay. In other words, well, we have a patent on it, Mr. Palomino, and we're going to have to charge, to give our stockholders returns on their investments on these vaccines. Now, what do you do?
Exactly. I mean, you can't. But the thing is that countries like Australia and India.
Well, we have.
But can something be done on the global level, not on WHO, but maybe on G20 or any UN platform where we'll talk about a vaccine and then we'll mass produce it for different countries and try to use it and maybe vaccinate the whole world. Is it possible, or I mean, these are just.
I don't know. It's an error.
It's a good point, Ankit, because that and in fact, they were asking about that yesterday. The whole world was waiting for WHO to make a decision, and WHO was not making any decisions. So, the doctors needed direction around the world, and that's what WHO is supposed to do, World Health Organization, and they weren't doing it.
Yeah.
Really, we dominated this conversation. What about Australia on this factor? Is the government giving up money to feed the people, or?
Yes, that's happening. So we've had 3 stimulus package, and that's injected lots of more funds into the system. So now, exactly what Nick was saying, the average person has like $1,500 a fortnight. That's going to come through social service,
right?
Like the dole system. So that's how it's going to be done.
Yeah, I think that's awesome.
Yeah, I think I was searching on the internet that are there any insurance companies coming forward and donating or putting their front foot and doing something at this situation, because I've never come across any article or any news about insurance companies globally. Do you have any news about them?
No, I have not seen anything on that.
Yeah. Nick, what about you? Do you think they will come forward and do some donations or do some kind of activities, because they are the one who are protecting us?
No. thing is, you know, if you look for other organizations to help you, I mean, that's good luck with that. If it does come the way it look fine, but the number one thing you need to do is rely on yourself. In other words, how can you help yourself in this particular situation? The number one thing you can do to help yourself is don't get this disease. I mean, think about it. Okay, this doesn't look good. Okay, so the number one thing to protect yourself is do everything that they're telling you to do. Stay away from people, social distancing, wash your hands, very important. Okay, make sure that you keep your lifestyle healthy as much as possible so your immune system is up in the event the thing does come by, and then just ride out the tide, unfortunately. And we just don't know how long that's going to be. There will be some government assistance that'll come in. You know, when it comes, it will come. But the thing is, you may have to remodel what type of work you're going to actually do or how you're going to do it. Now, in the service economy, a lot of the services can be done on the internet. A lot of the work you can do is on the internet. So you can do a lot of your work virtual. So you try to do as much as you can virtual. But I see a big problem because, like, even the people that are graduating from college, they go, okay, now it's time for me to get a job. What job? See what I mean? In other words, the people that have jobs, what am I going to do? So the economy is going to take a big beating, not just a small beating. Yes, I know the stock market's up. Hey, we're going to throw $2 trillion in, but it's not. It's just, I hate to say it, may not even be enough. We may even see in the United States another stimulus package somewhere in the fall, because $2 trillion is a lot of money. Don't get me wrong, but it may not be enough to solve the economic problem that we're going to foresee in the next several months. So I think we have 2 months of this at IBM TV. We're going to be able to do coronaviruses for 2 months with no problem at all. And the real reason is this is the new normal. I mean, this is the way it's going to be, because people are going to be staying at home, and then also they're going to get bored out of the tears because they stay at home. I mean, one person emailed me and said, "I'm done with. I've watched everything on Netflix. I'm finished with it. Now what? You know, finished Netflix? How'd you do that? There's thousands of movies. You know." So the thing is, that becomes the problem. And even in mainstream media, one of their big problems they have right now here is they're doing reruns of all the sports events because all the sports events have been canceled. Yesterday, I watched Madden Sports for the first time to watch esports, where they had artificial football players playing each other because there's just nothing else on. No, that was really
VR football, VR soccer, VR cricket, virtual reality.
But
you know what?
Reality. Yeah, the
So
virtual
we
reality.
have had our doctors many times, Nick, tell us it's not just about eating healthier and staying home, but also exercise while you're home. Dr. Sagu, I hope he comes on here real soon, and Vital, I hope, and Mohammed, they all have these sound advices about getting exercise. Even Dr. Yo, or you, said the same thing. I always say yo. You, Dr. You, also said the same thing. Get that healthy movement and exercise, because you got to get those impurities out, build your endorphins, build your lungs up when you exercise. So we've got a health fitness channel. We got Ron, who's supposed to, let's get people watching him. He goes live on Wednesday nights with some things. I haven't been able to go. But let's start getting something on TV that gives us some prayer, some exercise, meditation. There's hot yoga.
Yeah.
Yoga.
Also, our e-commerce channel. We got to talk to Ankit about getting our
e-commerce. We have an e-store now.
Yeah,
we have
the dollar store, and they said they're going to try to open up globally, but that's going to take a while. But they certainly are. The dollar stores open up in the United States.
Well, if we partner them with Amazon, it won't take a while.
Yeah. Yeah. So anyway, the thing is, there are going to be some new developments, but I just think that a lot of the stuff we're going to see, the new normal, will be this: trying to get the people in on the coronavirus and the updates. I think the thing that we need to move to is looking at the cures for the coronavirus and start interviewing the people that are actually developing the vaccines. because without this thing's going to continue lingering.
So we know, eventually the vaccines are going to come out. But I was listening to Willie, and we got carried out. But Willie, 3 stimuluses. When did they do this? I'm curious.
One came out yesterday. One came out yesterday, as in yesterday here now is Monday. One came out on Friday.
Wow.
And and one was like a week before that, or 2 weeks before that.
So let me ask you this: when they do a stimulus, do you have to read through it to see how you're going to get screwed? And I mean, do you have to read all the fine print like we do in America? I mean, do they write a bill around it and then they fluff it with all this fluffing stuff of, while we're giving you money, we're going to give money, billions to this guy, and Uber's going to get, 300 million. Did they do that?
No, not that. Just, but like Nick was saying, this is more a direct to the people, like the 1,500 a fortnight. That's from they gave it to like the tax and social welfare system, so that you get that back.
Okay.
The stimulus package from an employer point of view, or what in Australia we call an ABN, Australian Business Number. Theirs is done differently. Theirs is a projection of what you've been earning previously, and then you are allowed to keep the tax component or something like that. That's what an accountant.
And also, Willie, I've heard about. I was going through the press conference of the Australian Prime Minister, and he also mentioned that they are trying to stay away, and not more than 2 people can join a conversation.
Yes, that's come into effect. Yeah. So now we don't have a public congregation, only max 2.
Maximum 2.
The more than 2 can only work if it's immediate family, or even in your home. Immediate family or the people who live there.
Mm-hmm. And how much distance the Australian government are trying to maintain between the 2 people? Because in India,
that's now become an Australian police enforcement thing.
Okay.
So the police enforce.
Mm-hmm.
Yep.
Nick, I also wanted to know that in India, when someone is suffering from COVID-19, so if they're not doing the public hospital, or they're not getting treated at the public hospital, they end up paying around $2,000 every day.
Really?
If the person is not ready to do the public hospitalization. So if you go to a private hospital, and because of the ventilators and ICUs, the people are end up paying around $2,000 or maybe $1,800 every day.
Wow.
What's the status in USA in terms of the? Because I'm not sure whether the insurance companies covering the COVID-19 and people who are suffering from diseases, like COVID-19 from past a month or so. So how they're managing the expenses?
Yeah. Well, the thing is, I think that there's a good group of the population that have the coronavirus that are not seriously ill with it, and they just tell those people stay at home. Okay, but then the ones that are seriously ill, then they're admitted to the hospital, and then the triage takes place. So it really depends on how ill that you become. And that's the reason some of the doctors that we had on previously were giving some good advice. Basically, bring your immune system up as much as possible so you don't get, if you do get this, you don't get seriously ill. Because remember that the death rates are still, and I'm not going to say this is only, but if you're over age 60, it's 3%. Less than age 60, it's actually very negligible, sometimes less than 0.5%, 1/10 of 1%. The real thing it affects is if you're 70, 80 years old, it jumps to 10 to 15%. And so the 60 to 90-year-old group is the group that's seriously adversely affected. And people that have compromised immune systems with the age are even more affected. So this is one reason our physicians that we had on previously were saying, build up your immune system, because you don't want to be in that compromised category. Because if you think about it, well, even if you're over age 60 and you get this, 97% of the population will live. So the odds are actually in your favor tremendously. If you're under age 60, it's even greater than that. In other words, the odds of you living are tremendously in your favor. You may not even have to be hospitalized. So those are the realities of the situation. Now, in India, my question is, do they have a stimulus package over there? Have they done that over in India?
Yeah. So we have a stimulus package is already announced by the government, and apart from that, all the state governments are also creating different packages, and all the ministries or maybe healthcare ministry in India and in the states, they're also applying a lot of similar packages. So there are a lot of packages going around for different communities.
Okay. Well, how many cases do you have in India right now? We have 146,000. How many cases do you guys have?
So we have reported cases of around 1,000 plus as of now.
Only 1,000, not 146,000.
No, that's what I've told you. We have locked down at a good point of time, and we have closed all the flights, and that's why we are safe. But what's happened is that, like people from New York are going to Florida, and all the roads or the highways are stuck, and there's a lot of testing going on in USA. Similar thing happening in India, because people who are stuck in different states and cities, they wanted to go back to their native, or they wanted to go back to their home. And because of the lockdown, it's not happening. But government, wanted them, because it's a lockdown for 21 days, and maybe it can extend for a couple of more weeks. So government told them that if you have to go, so there is a deadline, and they have to go and reach out to your place at this point of time. But there are a lot of people, like millions of people, are on road, and they are walking for around 400 miles, 500 miles to reach out to their destination, because the public transport is not available. So we just have buses from the state government and the central government who are trying to ship or maybe transport those people from one place to the other. But because of the population, the people on the road are around more than millions, maybe 5-10 million. So a lot of volunteers, a lot of organizations, a lot of state government teams are supplying food, shelter, and also they're testing those people on highways itself. So we have quarantine. We have quarantine parks, or maybe we have quarantine tents on those highways, and they are getting the testing done there.
Yeah. Well, okay. So you only have 1,000 cases. Now look at these impressive numbers.
Ask Willie. Ask Willie what his is.
Now, what is it in Australia?
Your stats.
With total number infected from tested cases is 4,245. And our total deaths has been 18.
18?
Yeah.
You guys locked down on 18?
They have a good healthcare system too. Yeah, just like India.
Okay. Look at these impressive numbers. How about 144,000 cases? How about 2,600 deaths? I mean, the U.S. is just, we're taking off like a rocket right now. And
we only have 4,500 recover right now. And I hate saying it, but that's a low recovery rate.
Yeah, and I've been watching this. It's growing at the rate of 20,000 a day here. I mean,
so I watched the WRAL news last night, which was a big mistake, but it was still on after the concert they did on TV. And they said that they estimate, now this is just an estimation, but they estimate about 70 per day in North Carolina now.
Growing at 70 per day. Yeah. But see, North Carolina, we're still far down there. As you notice, we don't even make the top 10.
Not right now.
But I think your domestic flight is still going around. So, I mean, that would create a lot of panic, and that would spread the virus across the country. Because if we are checking the stats, especially of USA every day, and it was at New York and some areas of some other states. Now, if you see the stats, it's all over the country. Mostly all the major states have the coronavirus cases. So I think the domestic airport should shut down, and then you have to do the testing at the airport itself. Whatever, I mean, the steps should be taken ASAP, because also one of your health secretaries at the press conference at White House mentioned that the cases might grow to 1 million, and they are expecting death from more than 100,000 people to 200,000 people. That's what he quoted and mentioned on the press conference held at White House. So everyone is surprised and strange why and how America is. I mean, I don't know what are they trying to.
Well, it's a problem here. I mean, as you notice in New York and New Jersey, they lead the way with the most, and that's like I said, that's a very densely populated area. California is our largest state, so they have a lot, as you can see. Michigan's a fairly populated state, along with Massachusetts and Florida, and Washington was the first state that it was introduced to, and they have the most deaths because it hit a nursing home. Well, this is a big problem, and today we're seeing 146. Tomorrow,
look at the deaths in New York, Nick. Though, look at the death rate in New York.
Yeah,
our death rate's more than infected rates in India right now.
Yeah, that's true. Yes, we're quite impressive.
1,063.
Yeah, 1,063. Yeah, it's quite impressive. But see, we're looking at
that's why you have naval ship converted into a medical hospital in New York.
Yeah, if you project this into next to tomorrow, we should have over 160,000 cases by tomorrow. That's how fast it's growing.
Well, and again, these are 10 days late. These are stats 10 days ago, except the death. The death is right. The infection is wrong. I think our infectious rate is close to 500,000.
Well, these are the known.
About the naval ship which is parked at the New York Bay.
Excuse me?
So, do you want to mention about the naval ship which is converted into an hospital in New York?
Oh yeah, they're running out of hospital beds. I mean, what the Army was called in to build a bunch of hospital beds in the Javits Convention Center. So they're turning our convention centers into hospitals. And once they do that, they plan on doing that in other convention centers around the country, because we can't build the hospitals and the beds fast enough. Hey, Sasha has just joined us from Canada. Canada, yes. How are we doing, mate?
Everybody. There's one reason I want to tell you why I came a little bit later than usual. I got started watching this show on Facebook thanks to a hit link.
Yes.
And I want to tell you, the show is fantastic. It's so captivating. I couldn't even get to prepare my coffee or breakfast. I was just watching every second of the show. It's incredible. I'm really impressed. Now, I want to elaborate something on what Nick you said earlier about the company, for example, Gilead, who is developing the vaccine, and what would be the fair deal to do with the profits, whether it should go to shareholders. Actually, I was buying the stock from time to time. I don't have it now.
Okay.
But, I know the company more or less.
Right.
And in my opinion, there are two things what should be considered. Number one, of course, shareholders are entitled to a fair share of profits. However, don't forget that the reason why they developed this vaccine in the first place and why they would be so successful in selling it or distribute or whatever it is because of this coronavirus in the first place. So if it wouldn't be for coronavirus, they would never develop vaccines. They would never get these profits. That's number one thing. However, the shareholders still have to get the fair value of the profits, whatever is there available. Now, the second thing is, even after they will distribute it at a fair price, nothing prevents government to subsidize that price to end users.
Mm-hmm.
Give them maybe coupons or give them some special code where whenever they're buying this vaccine, they would get a special discount.
Mm-hmm.
How about that?
Yeah, well, the real question, of course, is what is a, quote, fair price? And there may be some data in the past that somebody could do that. And is there a law that says they have to charge a, quote, fair price? Or what is a fair market value price on this? And that's an area I don't really specialize in. Maybe we'll get an attorney that works in the health field on that in terms of the pricing of the vaccine. But I believe that this is where we're headed toward, is a vaccine either by Gilead Science or Moderna Group or another group that comes up with a vaccine. And, there actually might be multiple groups with multiple vaccines that
So
are
it will be market competition.
Yeah, right. In other words, there may be more than one. In other words, it may be one. And then the other problem they have is that because they share the information, they go, well, it's really my idea. And the other company comes out with tomorrow, what was my idea? And they all claim it to be their idea in terms of the vaccine. And they could also be developing it independently. In other words, because they all have access to a lot of the same information through MyRNA, which is a website that basically says, okay, here's the breakdown, here's the blueprint of the coronavirus, and here's our possible solutions. So I think we're going to find the end game to be very interesting here as to who's going to dominate the vaccine market spot. So while everybody's jumping up and down and we got to quarantine people, we have to mobilize hospitals, we have to do that. At the same time, there are vaccines that are being developed as we sit. They're going through clinical trials as of today, and they're going to be released. So definitely, probably within the 8 or 9 month period that we're looking at.
So they will end up suing each other, and then
of course. Well, then, hey, look. Then
remember a movie?
It's the American system, but as you know, the patents right now are international. So the thing is, once they file a patent, they'll file it internationally. So then you get to sue in all these multiple jurisdictions, which creates something very exciting.
Do you remember a movie, A Demolition Man?
Yes.
I've heard of it. Yes. I'll probably have time to watch movies now.
At one point, okay, he's in the future, and this guy, I forgot his name, he would like to go to a restaurant. He says, yeah, sure, I'm hungry. So I'm taking you to the best restaurant. They're going, and the sign is a Taco Bell. But they're getting inside. It's a luxury. It's a 5-star restaurant. There's a pianist playing on grand piano. It's just exquisite. He says, how come? Taco Bell? Is this Taco Bell? He says, yeah. In 2010 to 15, there was a huge war between restaurants, and Taco Bell became a winner. So now all restaurants are Taco Bell.
All restaurants are Taco Bell. Well, yeah. And the thing is, it's not hard to predict this future of what's going to happen here, because not that anything like this has happened before, but a lot of the parts have actually happened before. So what's predictable is in the next 2 months, because we can see the demographics, the economy is going to go into a big funk downwards. And then all of a sudden it will heat up. And the thing is, no matter what happens, viruses don't respond very well to humidity. So the rates will start actually going down because of the heat and the humidity. And then we're going to see more vaccines that are going to be developed, and they're going to be promising. They're already out there. And then all of a sudden, okay, how are we going to manufacture and distribute these vaccines? And who's going to profit off of them? So all that's going to take place in the next 8 or 9 months. Now, we would like to do it at IBM TV is report on it. And so the first thing I'm trying to do is get the vaccine companies and they have media sites to actually make an appearance here on IBM TV, and we should talk to the horse's mouth. In other words, talk to them about, okay, what's your plans, guys? Okay, what are you going to do in terms of the profit? Because there will be a big profit motive distributing how many billions of vials of vaccines around the world. I mean, there's just no question. Even if they made $1, that's $7 billion if they made $1 a vial. But you and I know that they charge more than that for these vaccines. And once they have it and they manufacture it in India, it doesn't cost them $1.
So, in America, we we have a short window of time, but if you are due diligent and you go see your medical center or your doctor in that window of time, they would give you the vaccine for free. So there are some cases where they feel like the necessity to give everyone the vaccine and make sure they're vaccinated. they will offer it for free. Now it's your choice, right? Do you want to be infected? Because they'll tell you the disclaimers like this long, right? That, you know, you could get sick from it because it is the virus itself usually, or combined set of viruses. We know that certain medications, we've heard rumor that certain medications for previous diseases are helping the patients, but this is not the final preventive medication, which Nick keeps saying. We have to get to that point. Proactive versus reactive, right? And but the question then comes down to, are you going to take it, right? What's in it, and are we the first guinea pigs? And I think, you know, that's just, we're going to have to see how that pans out. But yeah, Nick, I think people are going to make a lot of money on this, a lot of money.
Yeah.
Everyone thinks it's China. What is your thoughts?
Oh, I'm not sure. I think the problem started in Wuhan. I mean, the thing is, but it could have started anywhere because, and this is what Bill Gates was saying in his videos, which I did try to post, is that it's the mutation of viruses. It even exists in hospital with in other words, the thing is the mutation of viruses is going to take place, and he predicted this 5 years ago. Viruses that do not respond to antibodies as we are antibodied up start coming out. And this isn't going to be the first time that this is going to take place. This is going to happen again in our lifetime. The question is, are we going to be prepared better for it the next time it happens? I believe we will, because now it's become a reality as opposed to Bill Gates running around on TED Talks, you know, because he's been running around on TED Talks for 5 years. He goes, the biggest challenge we're going to find in our lifetime is the mutation of viruses that create 30 million deaths. Okay, and everybody don't listen to Bill Gates. All right, now they still don't listen to him, but they have to listen to this now, and that's the real problem. And so even though we're seeing this mutation, this one mutant, probably go under control sometime this year, there's going to be another one. It may not be from Wuhan, China. It could be from anywhere. A virus that mutates somewhere in Brazil, for example, could, in Rio de Janeiro or Sao Paulo, could go spread around the world in no time because of our transportation systems.
And that's pretty true. And I think people have been kind of predicting this. What exactly, like there was some concern yesterday and over the weekend of the poorer countries who won't be able to handle this, the ones that haven't been hit so far yet, but they actually are, as Africa and places like that are not financially equipped nor medically equipped to be able to help their people. We saw this with other viruses in the past. What is your thoughts on that? Oh no, he's saying something profound. Is he? He's muted.
Oh, I unmute. Okay.
Right.
Okay. It's going to be an issue. I mean, obviously, some of the poorer countries, when the virus, the antibodies or the vaccines start coming out, can they distribute to them? But a lot of the poorer countries actually exist in the African communities, which tend not to have very many right now, at least that we know of. And it might be because of that warm theory that they just aren't as affected as some of the other countries. Still, it remains to be seen, you know, how far it's going to be spread. Right now, if you look at the demographics, the biggest country that has the biggest problem of this is the United States of America. We're the ones
We can't sit still. We don't know how to stay still, and we don't know how to uncluster ourselves.
That's because Americans are countries of people that suffer from ADD. They move all the time. Think about it. The country was founded because they didn't like wherever they were at, and they moved over here. Okay.
Yeah, I can still go to work. I got a fever. I can still go to work.
Look, if you were a go along, get along person, you would never come to the New World. Let's get real. So your ancestors are all don't get along, go along people. And so it just developed here, and that's been the culture here for years. So this is one of our things that take place here, and we are or were the world's largest economy. I'm not sure if that's going to be the case at the end of this period, because our GDP, no matter how much money you pump out there, our gross domestic product will go down.
Yes.
It just
Well,
will.
I'm very concerned about the tri-state lockdown. Have you heard anything about this, where they're talking about officially locking down the borders of the tri-state? I mean, we haven't shut down our planes yet. Our planes.
Yeah.
We shut down. I did not say. I said shut down our planes. But we haven't closed our airports, which we should do. But
there are legal issues. There are legal issues relating to that. In other words, whether or not they can do what they say they're going to do. But again, remember, governments can do this, and then find out later on that we really couldn't do that. Famous case, Korematsu versus the United States. We do things, and then we find out, it was illegal, but we did it anyway.
Does it happen anywhere in the past that US or maybe some parts of US or some states have been locked down due to some reason?
What they're trying to do is prevent the spread of the people from New York and New Jersey spreading it out.
Does it happen in the past that you have locked down some states because maybe in London as well you have locked down New York?
But see, Ankit, the lockdowns are kind of artificial. In other words, they say stay in your own house, don't go out. And if you do go out, just don't go out. Okay. In other words, enforcing lockdowns are harder than telling people to stay in their homes. So a lot of it is we're trying to get what they call voluntary compliant, get people to volunteer to comply and not go out and do anything. Now, enforcing it is a whole different cat. How you're going to enforce it, we're not really sure about that yet.
Back in January, this was a totally different world. I was in Miami. We were talking about how do we bring more people to Miami to do business with us. Mm-hmm. We're trying to bring in an influx of people. Now we're like, no, stay home. Don't come here. Miami is like, how can we keep people from coming down here? And Florida is saying, stay out of Florida. We don't have enough resources. You have New York. They definitely don't have enough resources. They are massively sick, massively dying. I'm nervous because my child's up there, and in many ways I want to bring him home, but he can't get home right now. So, like you said, there are so many government laws that prevent these kind of things. But if they did something like that, do you think humanity-wise, we're still going to make sure that they get things they need across the border? Are we going to still ship the food in?
Because again, the mortality rate on this is really for the older demographics, people 60 and up. I'm not sure if this would even be an issue if it was if we eliminated the demographics of people 60 and up. I'm not even sure if this would be an issue because the mortality rate is very insignificant. But it's the real problem is, hey, if you're over age 60, which in the great state of Florida, 25% of our population is over age 60, then that's where we're seeing the problem. It's just like the reason why Japan and Italy got hit so hard. Italy got hit hard because they have the second oldest population in the world. And this affects older people. Well, Japan, rightfully so, canceled the Olympics because they have the oldest population in the world. And so it's the elderly that really get it on the chin. The younger people, they tend to walk through this. So yeah, there'll be a certain amount of deaths, but I think it would be a mortality statistic that would be, quote, acceptable on a flu. But the younger people, India has a younger population. So why you guys are in lockdown, I don't know. You got a warm climate, a younger population, except you people.
They want to live longer because even if you're young, it still tears your lungs up.
For us, humanity is more than money, and also if we have done it.
Excuse me, what heresy did you speak, Ankit? What'd you say? What? I think he spoke heresy. What do you say? You want what more than money? Okay.
So in India, we believe that we are human and we can earn money or we can reboot the system again if we have done it in the past. And money can be made at any point of time, but we have to think about humanity and how we can survive. That's
Wow.
what we have message
Wow.
from here.
Wow.
And I think Dr. Sabu is on the board right now, and Dr. Sabu can share his views and ideas about it.
Yeah.
on-
Dr. Saku, why are you guys even worried about it over there? You got plenty of young people, you know, and you're in a warm climate. Why do you guys even care about this coronavirus stuff over there?
Nice to be connected with you, Nick. So, by data, if we go, India has 6.5% of the older population, and US has, I think, 16%, and Italy has a 22%, and Japan has more than that.
Mhm.
So, we have less than 50% of the older population as compared to the US. So, we have a younger generation, more younger generation, but Indian people, they have gone out of their country for the work. We have the greater population who has gone outside, Italy, in the US, in Canada. So around 10% population is residing outside India. So we were scared of that we would be getting this COVID-19 from outside. So that is why our Prime Minister, Mr. Modi, has announced for the isolation and the complete lockdown. Basically, we are going according to the guidelines of the prevention of this COVID-19. And the guidelines say if you can isolate the clusters, then only you can fight against the COVID-19. If you cannot contain the clusters, you cannot fight against the COVID-19. So the principle is very simple that even we have a younger generation, but younger generation can also get this coronavirus. And instead of mortality, yes, mortality is there in the older population, but morbidity is there in the younger generation too. So even we cannot afford to have a morbidity as compared to mortality. If we are if we don't have good healthcare system, we are run out of our healthcare system, so we cannot afford to have a morbidity as well. So to decrease the morbidity, our PM Modi has announced for the lockdown. I think this is a good step.
Mm-hmm. Okay, so you think it's good, but don't you guys have what they call acceptable mortality statistics over there, saying, well, there's a certain amount of people that die every year of heart disease, and hey, that's okay. A certain amount of people die of this, and that's okay. So a certain amount of people die of coronavirus, and that's okay. Don't you guys have acceptable mortality, or is it?
No. Yeah, Nick, we are acceptable for that. I know that mortality rate is more in cases of accidents, it's more in cases of the diabetes, more in cases of the other cardiac disease or other brain disorders. But this mortality is low. I can understand that COVID-19 has a low mortality, but we don't have any vaccine. We don't have any medicine against it. We don't have good diagnostic workup. We don't have a good diagnostic tool for this. So once we get the diagnostic tool, once we get the vaccination, once we get everything in line for the COVID-19, then this COVID-19 would be like the simple flu. Right. So at that time, we don't have to worry about that. But now, because we don't have our enemies, we cannot see the enemy. For the invisible enemy, we should be scared of that.
Yeah, that's a tough one because you can't see it. What about ventilators? Do you guys have a lot of ventilators over there? You know, in other words, if it did break out, do you have enough ventilators to take care of the people?
Yes, we have. Our total hospital bed is around 70 lakhs, and we have a 7 lakh of ventilators, IC units in India. But we are getting more units now, and the requirement for the ventilator is only 5% of the infected patients. So that is why this isolation, this lockdown is in process, because if we can decrease the number of the total infected patients, so we can decrease the number of the patients who will require the ventilator. Mm-hmm. So, This is a pre-planning. If we would have 10,000 patients, then only 5% of those they require the ventilator, and that much of ventilator we have. If we have a 1 lakh of the population, and if we need a 5 lakh of the ventilator, we have in place. Even if India has total infected patients, up to 1 lakh or up to 1.5 lakhs, we have enough ventilator right now at present. But if the total number of the infected cases goes up, then there would be a problem. The same is there in US. I think now today the total infected patients in US is 1,43,000. So those 5% of those patients, they require the ventilator. So the requirement of ventilator is more in US because the total number of infected patients is more. So that is why to check that total number of infected patients, this lockdown is there, this isolation is there.
Right. Yeah. Okay. Okay. So you want to flatten the curve because Ankit told me you guys only have 1,000 people that are infected. Now we have 144,000 growing at
144,000
a day. So we're pretty impressive over here. We grow things very rapidly. So the thing is, are you trying to prevent that from happening over in India? Is that the reason why the lockdown? You don't want you don't want 144,000 cases.
Yes. If this measures has not been in place earlier, because Nick, you were not there at that time, but you see the timing of lockdown is very important. Earlier you do the lockdown, you will see the effect. Later you will go for the lockdown, the effect would not be there. So basic principle is how you can have a less total number of the infected patients. Suppose the Italy did a lockdown at when there were 350 patients. India did when they have a 400 patients. China did at 350 patients. India did at 400. Italy did when there was, I think, 9,000 patients. And US did in some places when there was 11,000 patients. So when you have already 11,000 chains working of COVID-19, how you can check all those patients who are in contact with all those 11,000 primary chains? So when we did a lockdown, we had a 4,400 patients. So we need to just check only 400 primary chains. So we can easily trace the contacts who were in contact with this 400 primary chains. So initially you have a less number, definitely you can have a check on that. But if your initial number, when you did a lockdown, when you did isolation, when you put all the quarantine measures, then it is very difficult to contain this COVID-19.
Yeah. Is there a vaccine being developed right now over in India? I know there's two companies in the United States, Gilead Science and Madera Group, who are both developing vaccines. They're going through clinical trials. Is there any group in India, because you got a lot of people over there, a lot of smart people over there who've developed or testing vaccines right now, Dr. Sagu?
So right now there is no literature saying that we have any company who is going in the direction of the vaccine manufacturing. But there are some companies who are just trying to develop that vaccine. And I'll tell you, in US also, they have developed the vaccine, but for the trials and for everything, they will take around 9 months to 12 months to develop the complete vaccine. So we are also looking at you, because in a humanity, we are a global family. So we are looking at you, we are looking at China, we are looking at Italy, because where the more patients are there, there would be more antibodies. And from the antibodies, we can extract the vaccine. So just we are looking, I mean, finger crossed, we are looking for the vaccine. If any part of the globe can develop that type of the vaccine.
Right. Well, that's what I'm saying. If you take the worldwide resources that somebody in the world, and right now, like I said, there's two groups here in the United States that are going through clinical trials. But I'm with you. We're looking at 8 to 9 months away before the vaccine's going to be out, no matter how you cut the mustard. So, Dr. Sagu, does that mean that IBM TV gets to run a coronavirus special for 8 to 9 months? I mean, seriously, are we all going to be in lockdown for 8 to 9 months? Hello? Is that what's going to happen?
I think if you have lockdown for, you can say 2 to 3 months, we can get the results. We can decrease the total number of infected patients. And good news that, you were not there at that time, good news is that we are working on the diagnostic. Working on diagnostic is more important than working on the vaccine right now. Because, we are in the lockdown period and we have already bought the time. This time we have bought for what? First, we want to see the enemy. Second, we want to send our spies to the enemy. Number 3, we want to weaken that enemy. Right? Number 4, we want to recognize or identify that enemy whose soldiers are very strong. We want to identify those strong enemies, those strong soldiers of that enemy. So that is why the Indian made in India, based in India, from Pune, one my lab has already manufactured the kit for that. And the diagnostic kits are very important right now, because once you are in phase 3, once you are in phase 3, you cannot only isolate the contacts who are in contact with the primary chain. You need to extensively test all those contacts. So to test all those contacts, we should have enough diagnostic kit. So that is why we are developing the diagnostic kit. And I think the kit which has been developed in Pune, that is very good. The result sensitivity and specificity is 100%. And the cost is also very, very less. Can you imagine the cost of one kit is 1200, that is 1200 Indian rupees, comes to be around $15. And that one kit, $15. Yeah. So that one kit can test 100 patients.
15 cents.
That, sorry?
15
cents. So one patient, 15 cents. So if we can get this diagnostic test done with only 15 cents for one patient, what we are looking for? We are looking for this. A number of the tests. We can do 12,000 tests per day. Till 25th March, India did only 2,542. 25,472 total tests. Yeah. So now we can do 12,000 tests in a day. And this company can manufacture around 1 lakh kits in a week. So we are getting stronger and stronger on diagnostic part. Even we are importing two more company kits, one from Germany and another from South Korea. But importing that will cost us a lot. So if we can get in the least cost from made in India kit, we can do the wonders in diagnostics.
Yeah.
So Dr. Zabu, can we set up some kind of an arrangement where MyLab can coordinate with some other labs and create more test kits? Because we are not if we are doing 12,000 tests a day, I think it's not enough for India.
No, what
do you think about it?
Ankit, you see, now the total number of patients are how many you have patients? You have 1,000 patients. And you see, this is not the true number. This is not the true number. If you want to see the true number, that I can say it would be around 10 times of this number. Maybe it is 10,000 patients. So we have 10,000 patients and we have contacts. So if we are doing, earlier what we were doing, we have done only 25,000 till 25th of March. So now, if we are doing 12,000 tests per day, I think that is more than enough.
But sir, do you think because a lot of patients are doing retesting because of symptoms, so they have to undergo a retesting session, and also you are also following the news across India that there are a lot of community spreading could happen the way people are migrating from different states, and we also have 25 new cases in Delhi because a lot of people have on Friday they were doing namaz and then they spread those cases on that scenario as well. So I still feel that
yes, look, Ankit, one thing is very clear that this is a disease of urban population. This is a disease of urban population, and and the spread of this disease is centrifugal. It is coming from the center, going to the periphery, that is the rural part. Yes, we have to test the rural part also, but we have only 35% of population, urban population. So we have a less urban population, more we have a rural population, and now the less tests are required. Once there is a complete community spread, once we enter into the phase 4, then it would be difficult for us. We would not be having enough testing kits also. We won't be having vaccines. We won't be having that much of ventilators. But if now the present scenario is, if we are testing all those urban patients, and so many neighbors, they migrated from Delhi to some rural places. So if suppose there is only one patient there who can infect all those, then it would be a very, very difficult for us to trace all those contacts and to go for the diagnostic and to treat them. It would be difficult for us. But now if we can curtail, so this is the answer for the Nick also, why we are under lockdown, because we don't want our rural population to be infected. If our rural population would be infected, it would be very difficult for us to fight with this COVID-19. So we want to contain this. We want to contain the clusters up to the urban population only. And right now, we are also importing 2 labs also. I told you from Germany and South Korea. That will also add on to some numbers of our daily testing.
And we have Dr. Aman with us, and I think she has more in terms of numbers of cases, what's happening around the other side of the India. And Dr. Aman, you have anything to share?
Aman, namaste, Sat Shri Akal ji.
So what we are looking at is, I think, as Dr. Sadhu rightly said, we are looking at the tip of the iceberg in India. It's maybe the crystal of the iceberg in India, the numbers, as you say today. So because in different parts, there have been super spreaders, as we discussed earlier. And so our reason for lockdown was first to really flatten the curve, that would mean just to spread the disease in time of duration, so that we can manage. We, at the present situation, India has 40,000 ventilators as of today. So 40,000 ventilators would not suffice for the kind of surge that everybody is expecting from the new population. So the lockdown is going to help us build up our resources, right from the hospital beds to the protective devices for the medical people, then the ventilators. That is what we are looking at. So dampening the numbers on lockdown, because we see how the lockdown has turned out to be. It is in parts, in urban parts, which we would consider lucky parts of India, where people understand the value of the lockdown. It has kind of met its purpose, but in other parts, it has, like, you can see all around, like lakhs of people moving on the road. So it has not solved the purpose that it was supposed to be.
And do you think, I mean, we are on the right direction in terms of the spreading of, because people are migrating from different states, and I think Punjab government have taken some steps against this migration, and they are trying to provide the food and all those requirements.
Yes, so we have some of the factory quarantine. We have asked the factories would be on, and the factories would be on, and people would be quarantined right from the all the workers and all the managers. Whoever comes to the factory has to pay, their food has to be provided, everything has to be provided, so that the production goes on. Plus the migrant labor, it is the panic in the migrant labor that how they're going to, and those who have to pay their rents. Even the government is giving a lot of relief. The rents have, 1 month rent have been waived off. They have been given rations, they have been given money, but still there's a lot of panic. People want to run to their houses because they think this is not going to just be till 15th of April, just going to go beyond that.
And do you think we are, we are trying to flatten the curve, and we are doing everything right in terms of what we have to do, and what USA is not listening, or, taking the right actions as what India is doing?
So one thing, we did not have an option. US is better prepared. So if you see all the sides of the discussion, US is better prepared. They have more ventilators as of now. If you see the global statistics, or if you compare with Italy, the mortality rate in US is very, very low. They are managing their patients very well. A number 25,000 increase over a day. They are testing. I think in US the test kits are available on the counter, right? Over the counter they are available. People are being tested because so many people are being tested. Now, if there are, say, 1,25,000, 1,45,000 patients in US, how many are actually hospitalized? What is the percentage? How much are hospitalized? And how many are critical? They are doing fairly well. I don't know. After a certain period, I don't know what percentage population of New York is going to be infected. So,
but Dr. I would like to,
right side of US not being locked down.
No, but it's not about they have enough ventilators or they have enough medical supplies. It's about we have to stop that spread, because they're not stopping the spread, and it's spreading across the USA, and then we have more numbers in coming days. And that's what the health authorities and the doctors are concerned about.
That threshold in certain parts of US, they've crossed their threshold where they can stop the spread. The brighter side of the lockdown is, yes, I totally support the lockdown that the Indian government has done. Had it been a better messaging and a better curtailing of all the migration that has happened, it would have solved its purpose. We are able to buy a lot of time. Yeah. We are able to buy a lot of time to prepare ourselves. We are going to spread out the numbers of patients that our medical staff would be taking care on day-to-day basis. because we just cannot handle that surge. We had no option. Lockdown was not an easy decision for the economy, for the governments here, but that was the only option.
And also, I mean, do you give any lessons from Europe, especially from Italy and Spain, that what are they doing right now and what we should not do to protect ourselves?
One thing is lockdown at the right time, lockdown in the right stage of the disease, which should have been done by all the countries. Now, most of these countries, they have crossed this threshold, we believe. The number of the number of asymptomatic patients, there would be patients who have not been tested. It has not been, I don't know how much is the contact tracing, how seriously you're going after the contact tracing, because in parts of India, if I specifically talk about Kerala, they claim that they have done almost more than 90% contact tracing, and they have well quarantined, and we are really very hopeful. We are looking at Kerala, how it stands out to be there. Even in parts of Punjab, the contact tracing and the quarantine, I don't know how seriously, how minutely they are following the testing kits, the test numbers, but yes, the quarantine has been very strict, and we are looking forward to great results because of that quarantine.
And some of our viewers are asking the question from Dr. Saghu and Dr. Aman that if suppose the neighbors are, quarantined forcibly by the government, or they have some cases of positive in the neighborhood, maybe in the next home, what kind of precaution they have to take and make themselves, how they can protect themselves?
So, Ankit, if your neighbor is quarantined, you are under quarantine.
Yeah.
And you have to follow all those guidelines who are necessary for the quarantine. You need to take care of you. You need to take care of your family. You need to take care of your society, everything. And here I would like to give you an example from the province Punjab. It's a very serious problem for the Punjab, because as we were talking about the rural areas of the other part of the country, they don't have so many patients who have come from outside. But Punjab is the only province where there are a lot of patients, they have come from outside. They may have hidden, they have not come out. One example I would like to give, that there is a Nawashehar city. Near the Nawashehar, there was one trace, Mr. Baldev Singh, who was died of coronavirus on, I think, 20th of March. And he was diagnosed on 14th, and from 14th till 20th, he was going to so many places, going to so many celebrations going on, going to so many gurdwaras, getting a lot of people coming into his home and getting the kirtan done by a lot of people. And because of that Baldev Singh, 23 patients are positive in Punjab. And today, there had been second death. Today or yesterday, there was second death, that Mr. Harbhajan Singh, he was also infected by that Baldev Singh. So these type of lot of examples would be there in Punjab. Dr. Aman would be right person to tell about that. Lot of problem is there in Punjab. We need to get all those contacts out and then test them. Not only isolate, test all of them. We want 100% test of all those contacts of the patients who have come from Punjab, and there would be extensive tracing and extensive testing for all those patients.
That is what our worry is, that people still not taking the right actions, and we are spreading it. And I don't know. We don't have to go out like the way we are doing in different parts of India and in US, maybe in Canada, because that's how we are.
Yeah, even in US also, some truck drivers who were coming from Canada, and they told that even in US, when they are going to deload their trucks, those all Americans also, they are not taking guidelines. They are not following the guidelines of isolation. They are not following guidelines of sanitation. They are not doing anything. So I always say that there are the policy maker and the policy taker. If policy maker and policy taker can go hand to hand, only then we can win the war against the coronavirus. Otherwise, we cannot.
So I'm gonna add in here, and I think maybe Nick too. What's happening is we're not having a global policy maker hit us. We needed who or somebody on a global scale tell us all policy wise, this is how we need to act. And even when CDC made their announcement and the National Foundation of Infectious Disease Director started making some extreme announcements, nobody was taking them serious. And we need a stronger voice making a stronger decision globally. And I think that's what I'm hearing from the doctors there in India as well. I mean, Nick, how do you feel?
Well, we're not good at following orders here, as you might know. So the thing is, even though they say, hey, we got to stay indoors, we don't. But there's some.
We're like Terminators.
Well, there's some practical problems. Hey, I need some food. I need to go to the grocery store. Well, when you go to the grocery store, guess what? You're going to run into other people that are at the grocery store, and some of them could be infected. The cashier that you that checks you out could be infected. So it's really difficult to keep that social distancing. Gloves are very important. I mean, the thing is, they might help. Mask may help. But again, we unless we're told what to do, and even if we're told what to do here, it doesn't necessarily mean we're going to listen to what people tell us to do. So it's just been the nature of the beast in the U.S., which is one reason we lead the world in coronavirus cases, with 144,000 growing at the rate of 20,000 a day. Now, there we go. That'll do it.
That's right. I'm a Terminator. We're going to terminate.
With that, the only solution I see over here is we have to develop vaccines. If we don't have a vaccine developed, we are so toast here, because it's just not going to happen any other way. We're not going to be able to slow this down without a vaccine. Two companies, Gilead Science and Moderna Group, both have vaccines under clinical trials right now. If the vaccine works, then in the next 8 to 9 months, as Dr. Sagu said, then we'll have this thing behind us. But in the
So
meantime,
I can't use my voodoo medicine?
no, I
I
don't
can't-
think that's
you don't
going to
think
work.
voodoo medicine
No,
can help?
that is sold on the internet at $9.95, and it cures everything. So there's
Corona. This is Corona. We're going to put Corona to bed.
a lot of scammers on the internet, but legitimate vaccine should be out probably in the next 8 to 9 months. The real problem is, can the people in the world, in the U.S., adopt this new normal, which is social distancing, wash your hands. In many cases, the businesses may go under. Qatar Airlines, somebody came on board to want to know about Qatar. Well, Qatar Airlines looks like they've cut their flights, and they may go out of business. And so which is a nice airline. It'd be really sad to see that happen. But the meantime,
Is this the lungs and kid on a CT scan?
what's that?
So this is being played by Dr. Jeff Ross from USA, and he's showing that how coronavirus series can look like.
Yeah, this you can see this the lower part of the lungs. Yeah, lower part of the lungs, they have much consolidation over there.
Oh, Lord. Okay.
That's what it does to the lungs. It tears the lungs.
Oh, that doesn't sound very good.
No, the Corona looks like this. Those icky sweet gum balls. To me, that's what it resembles. And Dr. Yu came on and he showed us the same thing. Pretend like this is getting into your lungs, and it tears the lungs. That's why they call it Corona, because of the peaks.
Mm-hmm.
The little spikes look like a crown.
Yeah.
So it's really a crown.
Corona is like a crown. It has spikes
It's like
on the envelope.
And that spike gets and hooks into the lungs,
Yeah,
and it tears
those
the
spikes. Yeah, those
Yeah.
spikes has a glycoprotein which binds with the ACE receptor on pulmonocyte, pneumocyte type 2. So all these spikes, they have a special receptors which are present on pneumocytes, that is the lung cells. So when these spikes bind with that pneumocyte, then it gets inside the pneumocyte by endocytosis, and there is a synthesis of mRNA, and the protein synthesis is there, and then there is a replication of the virus there inside the cell, and those all numbers of the virus, then they go into all the lung cells, and they damages all the lung cells and the epithelial cells.
So, and when this gets into the body, it's a permanent damage. Yes, Dr. Amanda.
So there's a question for those from America. what is the kind of messaging that you people get from your government? You get some guidelines, and what is it presently, and how did it pan out looking back 1 month, 2 months from now?
She was breaking up. Can you have her ask the question again?
Yeah. So, what are the guidelines that you guys get from the authorities, from your health authorities? What precautions to take? What is your lockdown like? And how have the guidelines changed over the last 2 months?
Well,
Wow.
it depends what state you're in and depends what city you're in. But basically, the guidelines
We're not united.
We're not united. They call it, remember, they call it the United States of America, which means the not United States of America. Okay, so it depends on where you are in America, depends what state you're in, and every state has different guidelines. Mainly right now, there are guidelines to be self-quarantined. In other words, you're supposed to stay at home and not go to work. Some of them are going into effect, depending what state they're on, tonight. In other words, like if you're in any industry, you're not supposed to go anywhere, stay home, wash your hands if you do have to go out, and that's about it. So the thing is, that's the guidelines. In other words, stay home, stay away from people, wash your hands.
So we have the
created fear. Have your authorities been able to create fear in your minds? Kind of panic that I think Indians are very, very serious about the lockdown, about washing hands, because we have been pumped with that messaging starting from the first month, 1 month back, and it is everywhere. You switch on your TV, you open your phone, you switch on the radio, everywhere. It is just one news, that is coronavirus. I think it's working well for us. So I'm interested in seeing how the messaging went on to you people, say 1 month back, and how the messaging now.
Yeah. Well, that's basically where we're at. In other words, they're trying to tell everybody stay at home and don't travel, don't go to work. In other words, everybody stays at home and no one goes to work. Work remotely if you can, and that's a real problem for us because we're not used to that.
If you can, as a problem.
Yeah, we're not used to that. In other words, staying home, no good. You know, we're not used to that at all. So with that, it's created a lot of problems. And some states, it's going to be the first day of this 30-day lockdown. 30 days. And in 30 days, it's all going to be over and we can go all return to work. Right?
Dr. Aman, I mean, Trump did it. Trump distributed a postcard to all Americans, and this is what the postcard says, that what you have to do and what not you have to do. And American they were expecting some mask and some sanitizer, but they got this postcard.
It's a postcard that came in the mail over the weekend from our beloved president, Mr. Trump. As you can read,
lack of communication between the scientists, the research part, and the government authorities. I can see all over the world, not so in America, because this would be according to medical guidelines. We would just not advise for this, because you all are connected. You have your connection, internet connection so strong. So,
this is what I tell people: don't listen to us. We're like, this is why I want this show, because you guys are at least 2 months ahead of us. So we're not going to see a flat line for 2 months. You probably already see your flat line happening. But this is
keeping our fingers crossed. Next 10 days.
Right. But this is our policy. Our policy hasn't evolved. Like Nick says, we're not united.
It's all about the American dream.
That's right. You have learned, Grasshopper.
You're learning, Ankit. Okay, that's the American dream.
You are very wise.
See, Dr. Singhu, what we're looking at is, okay, how are we going to be able to make money on the vaccine when it comes out? Okay. So the thing is, and how are we going to divide these profits? Oh, wait, you guys are looking at something else over there in India? Are you looking at something else? Okay.
Yeah.
Well,
we should get our panic button pressed now.
Right.
This is very important. what Dr. Aman wanted to ask is, have your president able to press the panic button on you? If he would have pressed the panic button, then only everybody can follow the guidelines of the current time. And here I would like to make a comment on this. But all things has been changed now as compared to before. When we were in phase 1, that was a different scenario. Now we are in phase 3, that's a different scenario. So now, earlier in phase 1, we were saying that mask is not necessary. But now, mask is necessary. Because you cannot, figure out with whom you are going. Number 2, the Nick was talking about when he was going to a grocery store. So if you can keep in mind that you're going to the grocery store and the receptionist or the manager of the grocery store is positive, you have to imagine that he is positive. Then only you can fight against the corona. Then only you can escape yourself, your society from the corona. Number 2, yes. Now, what is there in phase 3? Very extensive testing is very important. And because you say, if we see how the mask is very important, when you see the droplets are there, some particles in the air are there, if they are less than 10 micron, then they can fall very nearby the patient. If there are more than 10 micron, they can fall far distance also. The falling near or the far, it depends on the size of the particle plus the velocity by which they are coming out. By coughing, the velocity is, you can say, 10 meters per second. By sneezing, it is 50 meters per second. So now it is not there. The particle would be there within 1 meter of the periphery of the patient. It can go beyond 2, 3, or 4 meters. So always wear mask, because now there is a phase 3 and you can see a lot of patients over there around you. So now wear mask also. And who can get the infection of coronavirus? Only those person can get the infection who says that I cannot be infected by the coronavirus. So take everybody positive for the corona, then only you can save yourself from the corona.
So we are assuming at this stage that the India is, that let's assume everyone is infected and let's assume everything is contaminated.
Yes, you have to assume everybody positive.
Yeah. And for America more so, because you guys travel so much, your flights are still running, you eat out, you eat at common places, there is less cooking at home, right? A lot of people eat out, their daily eating is out. So that social distancing is very difficult to maintain. And as we say, even for India, this cannot go on perpetually. Like, we cannot be in a lockdown perpetually. We being doctors we might have to open our clinics very soon, though we are not in the emergency services. So we have to assume that life after corona or during this few months that we are going to see. So we assume that everything is contaminated, wear your mask. And I'm surprised why all the countries together have not been able to come up with a guideline. Wearing a mask at a particular stage should be a guideline. It should be a guideline by the WHO. Why is this so difficult? Why are we still discussing globally whether masks are required or not? There should be research. I think we need to come together on that platform. What are the guidelines? We are not locking down. Even in the lockdown, there has to be guidelines. An essential service provider. Who can be an essential service provider? What is the IQ? What is the understanding level of the disease of an essential service provider? You cannot make anybody an essential service provider. If he is not sensitized, you can't see the people that he is providing the services to. So there is a need to come up with very clear-cut scientific guidelines, and you have to have that tick in the box. This is what you do when you move out. This is how you wash your slabs. This is the essential service provider's gear. Even in India, we see that essential service provider, you cannot, and seeing the scenario in India, there is so much of difference of education level, understanding level, sensitivity. of people that you just can't keep a control over things.
Yeah, that
Yeah,
sounds like a good idea. But see, my idea is, can't you just give me a little pill and take care of all this whole thing for me?
That's America. Instant gratification.
Yeah, give me a little pill
Take
and
me
make
today.
the whole thing go away, or give me an injection right here and then make it all go away so I can go back doing what I'm used
So
to doing.
suddenly we started feeling that this very liberal mindset of an American, which is so difficult to change, and we Indians, we are so used to listening and following guidelines. There is a huge cultural difference that will come up to every place. You, as
We're
a very
waiting.
liberal society,
We're waiting for the Terminator to come save us. We are so Hollywood driven. We're
Yeah.
waiting for,
so
Yeah.
every time we put on Hollywood movie, there is America goes and saves the world, which we play all the time. Every time we see what's going on, where are the
I
saviors?
keep waiting for the music to say, "Don't touch that surface." No. It's gonna get you. No, we just we don't. Our mindsets just aren't there. I had all my friends laughing at me 4 weeks ago because I self-isolated, and they go, "Oh, Kim, you're taking this too serious," and yes, they were laughing at me. In fact, they unfriended me. They unfriended me.
So
They go,
there
"Okay."
is a lack of communication from the authorities or lack of seriousness level, because I think everybody in India would receive every day, I think, n number of messages on its social media, n number of calls regarding all the precautions. People that we didn't expect to be wearing masks are wearing masks. So I think it has got a lot to do with the messaging that the authorities are giving. We are being pumped with that messaging all the time as if we are on the brink of an apocalypse, and these are the things that are going to save us. So that fear factor is a lot, which I don't see in the Americans. We see it in the American doctors only. We see in the healthcare staff. We don't see in the citizens in general.
So
You guys still
I would
you still guys are having beach parties at least?
I would endorse the opinion of Dr. Aman that we should be sitting on the same table if we want to fight as a global family. So we should make some universal guidelines so that we can fight with the corona. So yeah. And I will take your leave now. So I'm sorry. Please carry on. Thank you. Namaste. Sat Shri Akal. Kim. Nick.
Namaste. Thank you, Dr. Sadhu, for sharing your wisdom and keeping us comforted with your words of wisdom and going forward, because that's what we're about now, surviving today so that we can rebuild tomorrow. That's what we need to do. And, stay away from Americans.
No. We are a family. We are a family. So we should work as a family. Yes.
We are one big family. Yes.
This is offline handshake.
That's right. Offline handshake. That's right.
Offline handshake.
I send my love and prayers.
What is the response of your citizens? How are they responding to the government's to the authorities' measures?
Everybody's worried, and Ankit has learned, but everybody's worried about money. They're not worried about their health. But you talk to a doctor or a nurse who's been working 24 hours, managing sick people in New York, and they're in tears. They're crying. It's very rare to see a doctor or nurse break down because they're so immune to, I got to care for people and this is part of life. But to sit there and see a nurse break down and cry on TV was all I could take. Because a lot of the people I know were not taking this serious. They were upset over having to shut down. And I kept saying, I know a lot of people live paycheck to paycheck. I'm concerned. I'm very worried because I rely on the stock market and investments. But that's not our first concern. We have to think about living today to survive tomorrow. But they didn't take that attitude. There was a lot of jokes. And you need to laugh a little bit about some of this, like the run on toilet paper. But then I became concerned about what's going to happen with food resources. But you have to realize we haven't fully shut down in America. We've got people now saying, please, please stay home. But we haven't really fully shut down. And for me to hear that there were 500 employees in a building yesterday upset me greatly. Even though it's human resources, our human resource business, had 500 employees in one building, and somebody came to work sick, and he was contaminated. But he came in sick with a fever, so he's been contaminated for 2 weeks. They're not looking at the people whose lives he's touched in 2 weeks. They're just looking at the lives he touched today. So that's where I'm a little upset and frustrated is we're not being smart. We're not thinking smart because we're scared we're going to make people afraid. And I agree with Nick. We should have been afraid weeks ago. We should have been panic-stricken months ago. I look back at the steps I was taking in January, and I had heard about this virus. In fact, I was talking with a friend of mine in Miami who kept saying, oh my God, Kim, there's a virus. We need to go and it's going everywhere and it's very dangerous. And I called a friend of mine in politics, in the government. And I said, is there something to be concerned here? You have more tentacles out there to globally. Oh, no, don't worry about it. And I think they knew. I think they knew a long time ago. CDC knew. They were having closed meetings that were only for certain people. And I think they just weren't sure how to deal with this because they didn't want to over panic. Let me explain to you our mentality. I live in a part of South where when it snows or freezes, we have to shut down because we can't drive in it. And we're very rural oriented. But whenever the governor says, you know what, I'm going to shut everything down tomorrow because we think we're going to get an ice storm that might be dangerous for children to go to school and for people to drive to work. And we shut down, then the people get angry if the roads clear up by mid-morning. And they shouldn't, because we really shouldn't have been driving in that storm early morning. But they're angry at him. Oh, we could have gone to school. We could have gone to work. But where I live is very dangerous. Actually, the snow doesn't melt for weeks, but that's the mentality that you deal with here in America. It's very instant. They want instant gratification. Like Nick says, I'm waiting. We're waiting for the pill. And I think we're being humbled, and we're not humbled yet. And I think that's what it takes to survive this. Our Bible stories say the meek shall inherit the earth, the humble. It's the humble. Somebody misinterpreted that word. It's the humble. And in your country, you're more humble than we are. So I'm sorry to take over. Welcome, Dr. Mohammed. And I haven't said good morning to everyone properly, but good afternoon. Good evening.
Good afternoon. Namaskar.
Namaste. Can you bring us some good news? Because right now we see the graph doing this everywhere. Can you bring us some good news?
Yeah, everything is good news. And just I want to associate your talk right now. It is an old adage. Health is lost, nothing is lost. Wealth is lost, nothing is lost. Character is lost, everything is lost. So right now we have to save our health first, and wealth will follow us. Money is a byproduct only. So when we do something good job or business or work, then money is a byproduct. So we should not worry about the money. We should worry about the health first. Okay. Today, till today, I was just calculating what is the cases and what is the total death number, what is the total recovery number across the world. But today I try to analyze the data, especially the country like Italy, Spain, France, Germany, UK, USA, India, Israel, and China. These 9 countries analysis data right now I have, and I prepared especially to discuss on this talk show today. See, I classified as a total cases, total death, total recovery, and recovery percentage. There is an amazing result as such. When we talk about the recovery percentage, Italy has 13% recovery rate, whereas Spain has 18%, 18.7%, France has 11.5%, Germany has 14.6%, UK has just 0.07%, America has 0.04% recovery rate. It's very shocking. India has 9.4%. Israel has 0.03%. China has 93%. How it is possible? How it is possible? Country, the superpower and the super technology wise, when we talk about, America comes first. UK stand close to the America, but the recovery rate is 0.07% for the United Kingdom, and for US is just 0.04%. So how come the 93% success rate in China? So I have a big questions. I'm big follower of President Donald Trump right now, because he says straightforward everything. I have one question. COVID-19 pandemic started from China, and China recovery rate is 93%, whereas all pharma giants, USA and UK, recovery rate is just 0.04% and 0.007% respectively. Does China has antidote? It is a big question,
That's a big
because
question.
without antidote, it's not possible. And when it's not possible, the whole world is worried about the life and death and how they recovered. One question. And
That's a good question.
second very important question. We should take a stand. See, we are a civil society. We should take a stand, because our peoples are dying right now. Global peoples are dying right now. We should talk right thing. The most important thing, why China suppressed outbreak of COVID-19. These two things are very big questions. If the China has the antidote or something, a special treatment technology, China should right now share to the global community, because China right now involved in manufacturing and selling their medicinal goods, masks, devices, everything across the world. So their duty is not that. Their duty is to take care first what technology they utilize and used to take care the population, and how they succeed the 93% success rate. It's a big question from across the world.
But
Am I right or wrong?
no one from China is really talking with anyone in the world right now about this. I agree with you. As humans, we have an obligation, despite our differences, to be humanity, right?
Absolutely.
I don't know what their obligation is with the World Health Organization. I think these are things that we need to be setting in place as we heal from this. And as we grow, we need to form a real World Health Organization administration, where we know for a fact that somebody from each country 100% is dedicated to reporting together as an ambassador of our healthcare. I think the problem is that China operates totally different from us. They have their ways. What you're mentioning is a lot of data that has been collected, and we need to sort through and understand. I think that there should be an antidote by now. I think there is, and maybe they're just testing it and waiting. A lot of times you know and are confident you have an antidote, like Nick shared with us, but you don't want to, in America especially, you don't want to give the antidote until you know it works. Otherwise, you'll have people that will die and you'll be sued. Because our country is about money. Our country is about the lawsuit, and they will make everyone accountable for every death. Not for every life saved, but for every death. So I think that's where America is at. I'm more frustrated over not shutting down The policies are not the same. Where you keep asking, what is America doing? We're not united. This is what I tell people. You have to ask each state. And then each state, you have to ask each county. So I have no idea what even each county is doing in my country, because that's where it pulls down to. We do have a federal government that dictates us by a whole, but you got to get your governor to agree with them. So, but we need to unite together as a world, and maybe we can here. We got India, we've got contacts, maybe one of our contacts in China, but let's start stretching our tentacles. Sasha, you might know some people in Italy, because Italy certainly will have the plasma with the serum in it, because we know with most viruses, the serum comes from the plasma of those who recovered. We don't know that 100% with this. But, when I watch the movies, they always, at the last very minute when the star's about to die, they come up with a miracle. This is real life. This isn't a movie. We need to realize that we need to join hands together virtually and work together. Sasha, do you know of anybody in China? You know so many people worldwide.
Okay,
somebody that plays chess. Do you know any chess players in China?
Actually, China has a lot of super grandmasters, and they're very good. So is India. India has a lot of super players, and one of them, Vishwananand Anand, he was for several years in a row, he was undisputed world champion, and he defeated several strong players, Vladimir Kramnik, who was as world champion, and defeated him in fantastic match. But then he lost the crown to Magnus Carlsen, who is undisputed world champion as of now. And but listen, Kim, I was very carefully listening to your speech just a few minutes ago. Let me comment on a few things. Number one, you are talking about humanity. The concept of humanity is very different in different societies. You're talking about Western concept of humanity, but other countries, I'm sure China is one of them. I'm pretty sure India, I'm studying now, but I'm not an expert on Indian concept of humanity. You have to really go into Buddha teachings, and it's not an easy subject, although it's very fascinating. Then, obviously, Russia has very, very different concept of humanity, and several other societies. I'm pretty sure the Muslim societies and so on, but I'm not an expert on that. But you grasp what I'm talking about. Now, second thing. If you remember, very recently, China and United States were at real war on tariffs and trades issues and many others. And if you remember, Trump was very adamant, and perhaps rightly so, that he was imposing new tariffs on China and so on, and China felt constraints of this policy. So now, if you imagine that China has indeed an antidote to coronavirus, and imagine that the United States economy is losing trillions of dollars every week, and it's going down in a big way. And let's imagine that China is not going to share the antidote with particularly United States. So guess what? A year from now, China will be a world economic superpower, and United States will be one of many countries there. With drawing in deficits, the deficits will go to probably 50, maybe $100 trillion. Nobody cares anymore, because it's our children and grandchildren They will have to pay that, not Mr. Trump. He doesn't care. He wants to get economy revived as soon as possible, A, to win the election, and B, to get his hotels full of people, because now they're empty. Nobody needs his hotels anymore. So, if you consider these options, you may think that, hey, China, where's your humanity? And China will say, Mr. Trump, where is your humanity, imposing all the tariffs and so on? Now, remember that very recently, 2 days ago, Trump told his vice president, Mr. Pence, don't call these governors who are not nice to me. Don't call them. Only call those people, those governors who are nice to me, who praise me. Oh, okay. So here we go. The boomerang effect. Now China says, oh, Mr. Trump, you were not so nice to us recently. How come? You have to be polite. You have to be respectful. And when you will do that, we will do certain things for you. Hello.
The humble will survive. You have to be humble.
Absolutely.
You have to be human. You have to be humble. And there's a balance, right? And but this is what I tell people. And everybody knows I'm not a big fan of Trump in many ways. But what I can count on with him, this is what I've told people from day one, is that he is a smart businessman. He might not be good, but he's a smart businessman.
Nope. The guy
he will not lose. But so
casino.
I think the antidote is there. So hear me out on smart business people. If you watch the Shark Tanks and any entrepreneur show, or if you take entrepreneur classes, or if you go pitch to millionaires for money, which I'm very accustomed to, I've done this for many years, they don't want a one-time solution. And anything that you're solving, they want a scalable MVP, a scalable product. So say in this situation, just as an example, don't take this for word, but they don't want to sell you the antidote right now. All right. They're going to make more money selling you medical supplies and masks and new shields, the new shield, right? That's a scalable MVP, right? So we have a problem and we need to solve it. And so each scalable situation solves that problem. It's kind of like the telecom industry. I was in the labs building fiber and broadband backbones back in '93. We actually established the first ones and we're trying to launch them. But the industry says, no, we need to scale this slower. I was ready to launch in '93 with fiber backbone. In 2000, I was ready. We didn't get fiber backbone in our country until 3 or 4 years ago. So you're looking at over a 20-year span that they wanted to scale models of Ethernet, of frame relay. They wanted to scale all these other things first to make money off of them, because the fiber backbone would have been the full solution to a lot of problems. So you got to look at a lot of businessmen. They want a disposable product, right? Something that they have to refurnish in your life over and over. So I look at this now as the solution is going to come in a business mindset. And first, they got to sell us ventilators that the price skyrocketed on, right? Other medical supplies. Let's give you a somewhat solution right now, and then the full solution will come out later. And I hate saying it, and you know what? Prove me wrong. This is what I tell people. Prove me wrong and you'll make me happy. But my mind sees this as a business transaction now. This is not about humanity. And prove me wrong. Please prove me wrong. Come out with the antidote tomorrow. This is why I tell people, I love it when somebody proves me wrong, because this is the way I do things, because I was taught to break things and to prove they break in a lab, because that's how you make sure it works in the world, right? So right now I'm saying this is a business plan right now. That's how we're living. They got to make their money off of these things, and you know, we'll see a flat line, and that's when the antidote will start coming out. But they got to make their money in different ways right now. Prove me wrong, and I'll be the one jumping up and down and celebrating, because I want to be proved wrong on that theory. And this is what I tell people. And you're absolutely right. There are things that we should have been doing. I tell people, please keep your airports closed to America. We did not do smart. We're still not doing smart. I hear every day, the planes are cleaner. Yeah, but the person next to you might be sick. Where's the brain? You know, stop traveling. I received a call that I never wanted to receive in my lifetime. Is if you want to get your son out safe from New York, tell him to leave now. That brought me to tears yesterday. I want him home safe, but I think moving him now is more dangerous than keeping him where he is. Fortunately, he's like me. We're used to storms in our area, and he grew up locking down for storms. So he stocked up early. He was listening, and he locked down about a week and a half ago in New York. Before most people would consider it, he started locking down. So he made his last grocery shopping trip a week ago. But that was scary. That scared me, because I listen to these people. I trust them. They're very smart people. So when they told me, if you want to get your son home safe, get him home now. But New York is in a mess. LA is going to be in a big mess in a couple of weeks. Those are two bigger cities. Miami is scared. The people who are smart in Miami, I talked to a lot of smart scientists, and they kept trying to make a warning in Miami, and I don't think anybody was listening. I was there for the Super Bowl, and I heard about it during the Super Bowl. How many weeks ago was that? And
12.
I made a few phone calls, but the people told me don't worry about it. I still worried, because these are smart people I'm hearing from. But our answer now is, how do we join our hands now, Dr. Mohammed? If you've got contacts, let's start pulling people together now. Sasha, let's start making those ambassador decision maker now. I'm going to try to get 2 senators on this week, because they should be quarantined and at home right now. We had somebody join us, one of Ankit's friends, Ashok, who is politically connected in many ways. He gets to hear a lot of things. But I think panicking now isn't the solution. I think facts, not fear. Taking the facts we have, like you were reading to us the stats of, why is China at this point and we're not receiving an antidote? Let's find out. I say let's knock that wall down, whatever wall Trump built, because I think he didn't just build that wall with China between China and U.S. I think the wall he put up was between all the countries and China, right? And I think we need to knock that wall down and say, let's work together.
Absolutely.
And if you've got contacts, let's do it.
Mm-hmm.
I think I have a basic question. We all are learning for a good livelihood.
Absolutely.
And if we are not protecting our livelihood, and if you can't protect our family, and if you can't have good food, good air, good water, I don't know what we'll be going to do with this money. So the simple solution is, first of all, we have to look for what we can do at this time. And because we are still very different from each other across the globe, and this is a global pandemic happened for the first time. In the ancient time or in the past, we have a lot of world wars and things like that, or maybe some flus and in different regions, but nothing happened globally at the same point of time. I think African continent, they are little, they might be little safeguarding themselves, not letting people to come to Africa, but they have been facing a lot of pandemic situations around. I mean, since the time the Africa is in the continent and people are living here, because I think everyone knows about Ebola and the yellow fever and things down, but we never discuss about it on the mainstream. And now, when the problem happened to us, and especially to the developed countries like USA, Canada, UK, they are not able to handle the situation because initially they were playing with the money and the power. They were playing with this initially, and now this is not working. So that's why they have to close it and look for solution and globally come on a common platform and look for a solution from countries who are poor or maybe who have less resources. I mentioned earlier that countries with limited resources are doing a good job rather than countries with a good amount of money and good amount of stimulus. So,
look at your stats. Look at India's stats compared to the whole world.
Yeah.
Look at this. I mean, I look at this and I go, wow, you guys need to be teaching the whole world. I mean, 29 deaths. If this is true, you definitely secured the policy that the world should be following. And I think that's what Dr. Amanda Peake was trying to say as well, is that you've definitely secured the policy. Why isn't the U.S. applying these policies? Because look at the difference, 29 deaths in such a large populated tight capacity. And look at us. I mean, we're spread apart compared to you, except for New York.
I've shared a story with you that in New Jersey, in one family, there are 6 deaths happened in a couple of weeks back due to COVID. And on the other side in India, we have a place called Agra where Taj Mahal, if you heard about Taj Mahal, one of the heritage in the world and one of the monuments around the world. So in the city of Agra, one family they were suffering from COVID-19, and six family members got COVID positive, and they got treated, and they are back to their home within 2 weeks. Everyone is safe, everyone is healthy, and they are not. They have found negative now after 2 weeks of medication and support from the government of India. They are positive and they are living at home and quarantine themselves because of the current lockdown. And why it happened? Because they are into exports and they visited Italy, and the time they came back, they found that they are not feeling well, and then they get it checked and they got to know that they have COVID. And but that was too late, and then all the family members were got those symptoms, and they were isolated and quarantined and in medication for 2 weeks, and now they're safe. So why I'm sharing all these stories? Because there are still good stories around the world, as Sasha shared. We have to be positive, but we are still not connecting the dots. I'm afraid that I'm following. You won't believe. I'm following the news from Africa, from Australia, from China, Japan, Italy, Spain, USA, and I'm concerned. A lot of countries are not reporting. A lot of countries are on a different track. I don't know what's going on. I'm very surprised.
I have a friend in Africa. And we've been talking, and it's very, very devastating in Africa, where we were not really reporting that they had the coronavirus. The problem is they don't have the means to take care of their people.
True.
So, and reporting the stats, it is spreading very fast now. Again, remember how we mentioned that they're villaged, right? And it's very hard to go from village to village. But the villages are locking down. They're scared because they have no medicine. They have no financial means to take care of their people because they're a different infrastructure than anyone else in the world. And the rich are the very, very rich and will have the medical care. Yeah. Their education systems are just so dilapidated compared to ours and yours. So my friend is telling me that he's very, very scared. He's never scared, never. And he lives in a very far away village. So I talk with him daily to make sure he's okay. I share with him so he can share with his people what we've learned, wash your hands, because that's not something we do. That's just not,
Absolutely, absolutely.
the hygiene system is totally different. This is why Ebola took over. So, I share with him what we're learning here. Again, it's not their lifestyle. And, I beg him, like Nick said, just drink a lot of water. So I beg him to please find a good water source and continuously drink and wash his sinuses and ears and tell his friends. There's no money there in Africa to feed the people, to get them the medicines they need. They don't have masks. They barely have clothes or shoes. If they lose a shoe, that's it. They lose the shoe. He lost a shoe one time in a rainstorm. I felt so bad. It took him I sent shoes. So you can't, and then Italy, I would love to speak with somebody from Italy. I don't have anybody in Italy. Again, you're looking at different financial infrastructures. In India, your people trust your government.
Yeah.
Your people have trust.
I'll share a today's story. What happened? I mean, you won't believe. Whether you'll agree or not. In a state like Rajasthan, we have around around 7 to 8% of population of India, and Rajasthan government requested all the private hospitals for a time being that hospitals will be controlled by government of Rajasthan, and all the hospitals agreed.
Oh,
can you believe it?
excellent.
All the private hospitals have given their keys to the state government and tell them that you can run the hospital till the time the COVID situation is arriving.
Wow.
Can it be possible in your country?
No.
That is what I'm.
See, your country has an infrastructure of trust, of humility. Our country is not of that infrastructure. Sasha, you know the U.S. probably fairly well, living in Canada, right there on the borders. But even Canada took the care to shut down before we did, right, Sasha?
Yes, I think Canada doing, I would say, pretty good job. I wouldn't say that it's a perfect job. Perfect job was done in Singapore. And as I told you yesterday, I've seen an interview with Prime Minister of Singapore. And actually, when speaking about cases around the world, and I was telling about my friends and people that I know of in Italy and different London, I have a very interesting publication actually about something what happened recently in United States, and it was published just today or yesterday in Los Angeles Times. I would like to read it because it's very, very interesting and very unusual story. It's happened in Mount Vernon, Washington, with the coronavirus quickly spreading in Washington state in early March. Leaders of the Skagit Valley Chorale debated whether to go ahead with weekly rehearsal. It's a school choir. The virus was already killing people in the Seattle area, about an hour's drive to the south. But Skagit County hadn't reported any cases. Schools and businesses remained open, and prohibitions on large gatherings have yet to be announced. On March 6, Adam Burdick, the choir conductor, informed the 121 members in an email that amid the stress and strain of concerns about the virus, practice would proceed as scheduled at Mount Vernon Presbyterian Church. I'm planning on being there this Tuesday, March 10th, and hoping many of you will be too, he wrote. 60 singers showed up. A greeter offered hand sanitizers at the door, and members refrained from the usual hugs and handshakes. It seems like a normal rehearsal, except that choirs are huggy places. Burdick recalled, we were making music and trying to keep a certain distance from each other. After 2.5 hours, the singers parted ways at 9 p.m. Nearly 3 weeks later, 45 have been diagnosed with COVID-19 or ill with the symptoms. At least 3 have been hospitalized and 2 are dead. The outbreak has stunned county health officials who have concluded that the virus was almost certainly transmitted through the air from one or more people without symptoms. That's all we can think of right now, said Polly Dubbed, County Communication Disease and Environmental Health Manager. In interview with Los Angeles Times, 8 people who were at the rehearsal said that nobody there was coughing or sneezing or appeared ill. Everybody came with their own sheet music and avoided direct physical contact. Some members helped set up or removed folding chairs. A few helped themselves to mandarins that had been put out on a table in the back. Experts said that the choir outbreak is consistent with a growing body of evidence that the virus can be transmitted through aerosols, particles smaller than 5 micrometers that can float in the air for minutes or longer. The World Health Organization has downplayed the possibility of transmission in aerosols, stressing that the virus is spread through much larger respiratory droplets, which are emitted when an infected person coughs or sneezes and quickly fall to surface. But a study published March 17th in the New England Journal of Medicine found that when the virus was suspended in the mist under laboratory conditions, it remained viable and infectious for 3 hours, though researchers have said the time period would probably be no more than half an hour in real-world conditions. Well, I'm not going to read further because it's a lot of elaborated medical points of view, and they're talking later on about the fact that the singing is could be more infectious than if you're simply just talking or touching each other or so on. But that's a very scary story. It happened in a place where there were no cases recorded whatsoever.
Well, that's because you don't know you have it when you're when you get it.
Yep.
And this is something people, and we discussed this weeks ago on our show. We're fighting a ghost. You don't know you're contagious when you have it. The woman from Italy, she said life was great 2 weeks ago. Nobody had it. We were joking and laughing and having fun, pulling his story. And 2 weeks later, we're dying. We're sitting our beloved ones in a truck to be cremated.
You see, another tragedy in Italy was that it started in the north of Italy. And when they started closing things down, a lot of people, especially younger people, they started to move south to Rome or even further south of Italy. So they could infect people in the south of Italy without even knowing that.
You mentioned something in there that the WHO downplayed this, right? And Dr. Muhammad, I think you have mentioned this as well. Why are we not getting all of this united? The WHO downplayed this. The CDC downplayed this, even though they were probably internally having meetings about this. But they were downplaying it to the public. The president downplayed it to the public while they were dumping their own stock. I don't think the president dumped his own stock, but many of our leaders were doing that. They were downplaying it while they were taking care of themselves. Why were they downplaying it? This is what we need to hold accountable once we get well. And we need to pull together a new solution, a new ambassador sort for healthcare, a global ambassador program, kind of like I don't even say like our Federal Reserve, but where there are real people, not politicians, but real people who are there to make sure that globally we don't downplay this and we have one policy when something like this happens. That's what we're going to have to do. Because I'm going to tell you right now, this is not our worst. This is not going to be the worst.
Yeah.
This is preparing us.
It's a good news. It's
But
a good
Kim, I
news.
think
Yesterday
Yeah.
we were discussing about the some big players like Prime Minister of India and the President of US and some other leaders have come forward to resolve the supply and demand of medicine and medical devices and surgical goods and all. And it's a good news. Today, Mr. Modi, Prime Minister of India, has a conference with the ambassadors of different countries of the world. And what they discussed, I don't know, but I think he has discussed on the same line as how soon we can resume the supply and demand of medicine and medical supplies across the world. So you are an ambassador. You are the super hero actually. So you are just spreading good information and awareness across the world. So you are just guiding them up what to do, what not to do actually. I have one good news from India. I just want to share
Good.
the moment India imposed lockdown of 21 days, they started giving financial package to approximately 80% of the population. Now they started giving back to the nation. One company donated 700 million US dollar. Another company came and donated 100 million, 50 million, 25 million. And one good news, then 85 years old who collected money for pilgrimage to go to Makkah for Hajj, and he donated half a million rupees back to the nation. And this is a week we are celebrating out here 9 days fast, and it is totally dedicated to the prevention measure as well, because fasting increases our stem cells and
Yeah.
we feel good, and then we can fight back in a better way to the corona, and we are defeating corona and we are enjoying life. See, we are defeating corona and side by side we are enjoying the fasting as well as a religious ritual. So
So
right
I'll
now,
explain Kim,
everybody is giving back something to the society. We should give experience life back to the society. It is our responsibility.
I
so
think
Kim,
As a
Ankit
government.
had been sharing that earlier. Yes. Go ahead,
Well,
Ankit.
the first thing is that in India we celebrate a lot of festivals, as I already mentioned you, and we do a lot of festivals for our holy gods around the world. And not I'm not talking about a dedicated or a particular religion, but across the religion we have a lot of festivals. So we have a festival called Navratri where we do 9 days of fast for each and every god for 9 days, and then we do a lot of prayer and puja. I mean, with our family get together, and then we celebrate that festival, and that is right now going on. And this is the first time in our country, or maybe whatever 10,000, 20,000 years of our history, the temples are closed, and God wants us to stay at home, and the real gods are on the border, on the hospitals. I mean,
True.
helping people to gain or to live a good life. But still, and you won't believe. I mean, we have while doing those things, we are also showcasing lot of I mean, Shabas must be aware about it, that we are showcasing lot of religious I mean, new series or serials in India, and people are watching those things. I mean, those are 25 years old serial about some god. If you know that Ramayana
Mahabharata,
is not the god basically,
Ramayana,
and
yes.
so we are showcasing those serials, and people are watching what happened in that era, and how the good and evil played their role, and how the good or maybe the god fight it out and come out victorious. So that's happening in India. I mean, and that is all because we are still on a single platform and we are united. But there are a lot of people. I mean, not maybe 1-2% of people who are, I mean, making some noises or making some issues with the current situation. But still, we are good to go as of now. But I would request Abbas if you can discuss quickly about what happened in Nizamuddin and how the spread is going to happen in the community. And if we can request our society and our people across India and across the globe that we have to take care of the things, and because if it starts spreading, it's difficult to stop.
Absolutely right. See, it is a time of discipline actually. It is a time of discipline. It's a time to protect one and everyone and the nation. It's not a matter of any religion. We see religion is what? Religion is ultimately to follow the right thing. It is a time to follow the rules and regulation what government has given to us. So every mosque is closed right now, and every religious places is closed right now. Why Nizamuddin was opened? It's
Yeah,
not a matter of discussion. Even and there was approximately 1,500 people out there.
yeah,
Just they have evacuated only 300 people. Still
yeah,
1,200 people are out there.
yeah,
So police should take care immediately and forcibly. See, there should not be any mercy. Rules are rules. We cannot compromise with the rules. Rules are made for the comfort of people, not for discomfort. If we will be taking this flexibility, then they can harm the society as well. And Nizamuddin is a center of the world where all Muslims gathered from across the world to convey what is right, what is wrong, and what to do, what not to do actually. That's good. It's a very good thing. It's not a bad thing. But right now, it's a good thing is to be away from the crowd actually. Stay at home and be calm, cool and calm. Take 8 hours sleep. Drink frequently every hour. Drink probiotics. Okay. Take a vitamin C or fish liver oil. Okay. These are the mandatory things. And Ankit, I just want to
What we
inform
got,
you,
Ankit?
Ankit,
What do we got?
so this
Ganesha.
is Ganesha, and he's one of the most popular among all the gods, and they have around maybe more than million temples across the world, and
Mhm.
people worship Ganesha like anything. And then so we are very fond of this Ganesha, and then there are a lot of stories behind it. So maybe we should have a mythological channel discussing about all these things, maybe, because this is not the
I,
right.
you know, I think the positive words that we're sharing, influencing the positiveness that we can gain from being at home. Discipline, you could not have said anything better in life, because when you learn these disciplines, you're going to be successful in many other things.
Yeah,
You're just not going to survive today, but you're going to be able to rebuild tomorrow, especially if you're disciplined. This is something I learned talking with some very athletes, right? You learn these disciplines, but I think it came down to trust in being able to survive this. Who do we trust? Who do we listen to? Is there an antidote out there? I look at, like you were doing, the death rates in all the different companies. What is the mortality rate right now? I think, India took control of this quickly. You're going to see a very low mortality rate. Canada took very, very big precautions. Australia, but there are countries out there that either could not. And I think it all came down to trusting your government, trusting your people. I really do. We're still arguing here, and it scares me. I've already been locked down for almost a month. I
yeah,
haven't, and I'm going to have to stay locked down a lot longer, because I got to wait for everybody else to stay locked down before we know it's safe. And when I heard that there were 500 people at an office yesterday, and a man walked in with a fever, and this is a government office. He should have had that note, right? Where's that memo? But he walked in with a fever, but that was way after he's been contaminated. That was way after he was considered infectious. So they got to look at the people that he touched 10 days ago, 14 days ago, not the people he touched yesterday. And they're only looking at the people he touched yesterday. And so, again, we got to kind of look at everybody else and why they're surviving so well. I look at India. We need to be following your footprint. And I'm just going to tell you guys, keep your airports closed to America for a long time until you know we are healed. And don't just listen to the stats from the government because they'll start lying. I hate saying it, but somebody will misrepresent the truth in order to reopen the doors. So, yes, Sasha.
Just from my personal experience, as I've told you many times before, I was on a cruise ship in South America from 14th of February to March 1st. On March 2nd, actually, we landed in Toronto, Canada. On the cruise ship, they had a Fox News channel, and I was watching it from time to time when I was not busy with other things like casino and excursions and many other things. And on the Fox News, everything was quite positive, and Trump said that, oh, that's not a big thing, we all know about that, or so on. So it was a shock to me when I arrived to Toronto on March 2nd, and my daughter refused to see us for 2 weeks. And of course, we couldn't see her, we couldn't see grandchildren. We still haven't seen them. Well, because they moved outside of Toronto about 2 weeks ago because of the school break or so on. They have a cottage. And this is reality. What I faced was very different from what I've heard on a cruise ship on the Fox News. That's what I'd like to share with you.
Okay.
So do you think she did it right, not seeing you, or I mean, you have a grudge that she didn't
Well,
receive you?
at first I was very, very upset at her, and I didn't argue with her, but I told to my wife that, oh my God, how she could do it to us, or so. But then slowly, when the news started to crop up and the statistics around the world, and all of a sudden I realized that probably she is right, and that it's way much more serious thing that I ever thought about it.
You know, sitting at home.
You were about to say something.
Sorry?
Shabazz, you want to say something?
No, I am very happy. Whatever we discuss on the right track. We have
I
to
think
save humanity. We have to save humanity. We should pray for to the God that God please help us. This is the right time to help us actually.
Yeah.
Okay.
Agree.
And we need to join. We need to connect.
Yes.
We need to
United we
connect
stand.
all of the world. We need to
United we
connect all the
stand.
world.
Divided we fall.
That's right.
Yes. Yes.
And we need to
I
send
would
love
like
and
to
prayer.
play a story of one of the survivors from Britain before we wrap up. So just give me a moment because she is ready to share a story from Britain.
We got our little ambassador.
I'll just.
Good morning, Britain. Did you turn the sound on?
Let me. I think I've put it on mute. So you just continue. I'll just fix up the issue.
You have to put the sound on. I just learned that.
Yeah.
We have learned to use this tool on the fly. But I think we're doing a good job. Ankit did fun yesterday. He played our other intro. I loved it. I thought it was cool. We need to get a new one because we've got so many spokespeople. Like
I shared the new one. I mean, you need to approve it. Then I'll put it.
Yeah, I need to get some more headshots from our guests that are on our show every day.
Yeah.
But we definitely need to, and we thank you, Dr. Mohammed and Sasha, for being here every day to spread the good words that we need to hear. Let's see what we got.
Really bad. Please, none of you take any chances. I mean it. Because if it gets really bad, then you're going to end up here. And I'm just going to fight this.
Goodness me, it's hard to watch that. Tara
It's
joins us
eerie,
now
isn't it,
live
actually?
from Middlesex. Looking a lot healthier, Tara, which is good to see.
Yeah.
How long has it been since you posted that clip?
Oh, wow. I was in the hospital for a total of 9 days. I was in the ICU for 3 days. And I returned home, which was the best Mother's Day present ever. I returned home on Mother's Day to my family. So that actual clip is quite a while old now. And just looking back at it, it makes my heart skip a beat, because I actually thought that I was going to die at that point in ICU. I was told I was going to be intubated, and I didn't know what that meant. And when they explained it to me, that I was going to be put to sleep and sedated so that my body could fight this, because my body was exhausted, I just thought, I'm never going to wake up. I'm not going to see my girls grow up, and I'm not going to wake up. And it was very traumatic.
It's hard for us to watch. You could hear the distress. Of course, your description, but it was like having glass in your lungs. It's one that you can just picture. And you struck what many of us use, and perhaps actually some young people taking comfort in, which is that this is for people who are older. They have to worry most. People who have underlying health causes. And you're somebody who's fit, who's healthy, who's only 39, which reminds us all that this is serious for everyone.
This is serious for everyone. It doesn't matter what gender you are. It doesn't matter what colour you are. And it doesn't matter what God you believe in. Nobody is immune to this. If you get it, I hope for you that you get symptoms that are mild, which is the case for a lot of people, which is why a lot of people...
So that's
God, it's so bad. And obviously I'm hearing the news about the poor 21-year-old who recently passed away, which is so devastating. If you get it bad, I can assure you it will be one of the most traumatic experiences of your life, because every time you take a breath, it's like glass. And then your body gets so exhausted that you can't breathe. So to just take your breath for granted, you know, it's not until you can't breathe that you realise just how precious it is.
Tara paints such a vivid picture, Hilary, of the experience that she's been through as a very...
wow. That's the first time I've heard somebody talk about what it feels like to have it. How impactful is that? To one, see a survivor. I would like to have some news from doctors of what is the final impact to a human body after you survive it. Will you continue having problems? I'm very familiar with incubating people, putting them to sleep so that their body can rest and heal, because I've had to have it done. It's so that you're not fighting the whatever it is you're fighting, and your body can really rest. Because when you're awake and you're fighting the pain, you're not letting your body heal. So, but to hear her talk about it and how she's afraid that she won't wake up, that's understandable when you're struggling for every breath. Good news though, right? She survived it. Look, she was young. Okay, people, this is not an old person's disease.
Yeah.
This should give us a message right there. I got to have a long talk with Nick. This is not an old person's disease.
And also, it's more about immunity. I mean, people who have good immunity, I mean, they are surviving. And
right.
It's not about old, and she rightly mentioned that it's not about black, white, or which region you are and how much money you have. I mean, I think according to my view, people who have more money, they are more prone to this disease because they don't work with their hands, and they have a lot of people to work for them. And that means they are prone to a lot of spreads, because that's how the disease is going around.
And I think that they just think it's not going to happen to them. You know, I've got all the money in the world, it can't touch me. But I have a friend who just finished a song about that. He's very, very, very wealthy person who built what he thought the great life with financial stability and had everything. And I'm going to play the song tomorrow. He just released it. He is a famous person, but not for singing, but he is now. He's got 2 releases now. It's how, things like this can seize you no matter how wealthy you are. Sometimes you're not going to be able to stop it. There's not enough money in the world to stop these things. So I'm going to release his song tomorrow. But I think it's time to say goodbye to our friends and family and go spend some time resting and thinking about tomorrow. And Kate, wrap.
Yeah. So I'll just play the ambassador message in the meantime. Yeah.
कोरोना वायरस से कैसे बचेंगे? हैंड होकर और ऐसे अपने खांसी जब आएगी तो ऐसे करेंगे अच्छू अच्छू और कोरोना वायरस को धन्यवाद हमारा म्यूजिक सुनने का.
Lovely.
Teach our children well. Good discipline. Start young.
True. Stay well, stay happy, and take care of your neighborhood with your family as well, because these are all our family members. And if you have more, then you can feed to those pet animals and people who don't have the food and shelter at this point of time. And I think it's a wrap, and we'll see you tomorrow. Thank you. Take care.
Take care.
Have a good day. Bye-bye.
Good day.
That was a good show.